Having discussed the gram-positive bacilli, let us now get going with the gram-negative bacilli, because as I told you, all the bacilli are usually gram-negative. So we start with the family which has maximum members, and that's the Enterobacteriaceae family, which you classify on the basis of the lactose fermentation. But before I begin with this, let me tell you one common table that will sum up 90% of the things for you. These are all the members that you have in the Enterobacteriaceae family, and when you talk about which of them are lactose fermenters, remember all the ones with K in it: E. coli, Klebsiella, Enterobacter, Citrobacter. All these are going to be lactose fermenters. Whereas everything else like Shigella, Salmonella, Proteus, Yersinia, all of them are going to be non-lactose fermenters. So simple: K, E. coli, Klebsiella, Enterobacter, Citrobacter, they are lactose fermenters. So now I can come back to my classification. Yes, all these four main organisms that I was talking about, all the others become non-lactose fermenters, but we have one exception called Shigella soni. And that Shigella soni is going to sleep and then wake up very, very late. Sota hua, right? So he's going to wake up late. He's a late lactose fermenter. He doesn't ferment lactose immediately. He wakes up very, very late. So that means the classification part is done. Now let's move on to the urease ability. Out of this entire family, only Klebsiella and only Proteus is going to be urease positive. All the others are going to be urease negative. So should we do one common mnemonic for the entire bacteriology for urease? Yes, so I have learned you are gonna turn pink either when someone is gonna give you a punch, because of course the impact, or you're gonna blush pink when someone is gonna kiss you. So simple, you are gonna turn pink with a punch or a kiss. So the mnemonic for urease organisms are punch kiss. Out of them, note, the Proteus and Klebsiella were belonging to this family. The P and the K were belonging to this family. Other than that, urea plasma, common sense. Urea word hai urease. Helicobacter pylori, common sense again, because again Helicobacter has that urea breath test for diagnosis, so we know it. Then we've done Cryptococcus, Nocardia. These two you will have to learn. One fungus, one bacteria. Cryptococcus and Nocardia. And S and S may the two Staphylococcus saprophyticus and Epidermidis. I hope you remember which family of staph do they belong to. They belong to the coagulase negative family of staph. So you're done. So you are going to turn pink with a punch and a kiss. That is urease positivity. Over here, we've got urease positivity. Now coming to the motility aspect. So remember, that is E. coli motile. Yes, Enterobacter motile. Citrobacter is going to be motile. Salmonella mostly motile, can be non-motile also. Ma'am, Proteus motile. How have you learnt all this? Okay, let me simplify it for you. If you remember, we had a mnemonic that wherever the word illa will come, illa in south means no. So wherever the word illa will come, Klebsiella, non-motile. Shigella, non-motile. Okay, Salmonella also has illa, so non-motile, but can be motile. So usually Salmonella is motile, but remember there are some rare Salmonellas, like we have Gallinarum, we have Pullorum. These are the Salmonellas jo rare wale hain. Those are the ones which are non-motile. So remember the rare ones, Gallinarum, Pullorum, these are non-motile. The Salmonella typhi, typhimurium, usual ones are motile. All the others, they don't have illa, so they are all motile. Yersinia can have a differential motility. So that I'm going to tell you in a while, that you'll have to wait for. So simple, the Klebsiella, ella no motility, Shigella no motility, Salmonella, Gallinarum, Pullorum no motility. Now coming to the IMVIC testing. First you'll have to understand what is IMVIC. So this is the IMVIC testing that we've got. So I stands for indole, M for methyl red, VP for Voges Proscure test, and C for citrate. This is the IMVIC testing that you have. What have I said? If indole, methyl red and VP come positive, can you see a red color in which I've written them? So when they are positive, I'm going to get a red color for them. Whereas if citrate is positive, if citrate test is positive, I'm going to get a blue color for it. So you should be knowing these colors. For all of them, red color is positive. For citrate, blue color is positive. So now can you make the diagnosis over here? Whenever they are placed in 4 tubes, automatically understand that they are talking about IMVIC in that order. They've written it in the same order. So remember, red color, ma'am, first 3 ke liye to if red color is there, that is positive. Red color, yes, I positive. Next, red color, positive. VP mein I don't see red color, so negative. Citrate mein what is positivity? Blue, but here I see green, so this means this is also negative. What do I see? Plus, plus, minus, minus. That is a case of E. coli. Let's move on to the next one. Again, they have put it in the same order, that is IMVIC. Do you see red color? No, negative. Again, negative. The third tube is showing me a red color, that is positive. And citrate is showing me a blue color, that is also positive. So, ye kya bana? This is negative, negative, positive, positive, and that is a case of Klebsiella. So, simple, ulta hai. E. coli is plus, plus, minus, minus. Klebsiella is minus, minus, plus, plus. So, let me come back to this table and fill it up. E. coli plus, plus, minus, minus, and Klebsiella minus, minus, plus, plus. After that, you will realize who of them are shy. So, you will say, ma'am, I am shy. I am shy. So, slang mein likhta hai, I am shy. M for methyl red. Which are the ones which are only methyl red positive? Shigella and Yersinia. So, when I talk about Shigella, it is only methyl red positive. Yersinia is only methyl red positive. Last one that you have is Salmonella. Now, Salmonella, I will tell you in a while, has a test called the Vidal test, जिसमें एक बहुत famous, Vidal का होता है OH, which you have in Vidal, right? I've converted that OH of Salmonella into O से minus बन गया and H has been converted into a plus. So it is minus, plus, minus, plus. That is the IMVIC testing for Salmonella. Others you don't have to know because they show you a very variable reaction. So simple. E. coli, Klebsiella are opposites. Shigella and Yersinia are only methyl red. So I'm shy. And finally, OH से Salmonella, Vidal test जैसे OH, this is minus, plus, minus, plus. So this entire table is done and 90% of your headache is over for this chapter. Now let us move forward and talk about how did you see this lactose fermentation? What are the three main media on which you can see it? McConkey, Cled, and eosin methylene blue. Let's start one by one. What is the mnemonic for McConkey, guys? We always say that McConkey is going to be a pretty pink plant. What is pretty pink plant? Because if lactose has been fermented, you are going to get a pink color. So the pink over here stands for lactose fermentation. Pink plant. So what all does it contain? P for it contains peptone. L for, of course, lactose fermentation, dekh rahe ho, so it contains lactose. And because it is telling you a difference between lactose fermentation and non-lactose fermentation, that makes it a differential media. So P for peptone, L for lactose, A for obviously agar, it is an agar. N for neutral red. Now tell me something. When the color is changing, there must be an indicator that you have added. What makes it an indicator media? What is the indicator dye? And that is going to be neutral red. Very famous previous year question. And the T stands for taurocolate, like sodium taurocolate. Those are bile salts. They are always toxic. They will only allow this family to grow, Enterobacteriaceae. They will not allow the other members to grow. So that makes it a selective media. So tell me, McConkey is what? A differential, indicator, and selective media. What makes it differential? Lactose. Indicator, neutral red. Selective, taurocolate. That is why I said a pretty pink plant is McConkey agar. What's the next one? The next one is Cled. Cysteine lactose electrolyte deficient. I can see over here that the fermentation, if lactose has been fermented, it's got a yellow color. Over here, yellow color. But ma'am, background to blue hai. Yahan par it is all blue. What is the indicator? This means blue. Bromothymol blue. The indicator is said to be bromothymol blue over here. What was the indicator in McConkey? Neutral red. What is the indicator here? It is going to be BTB, bromothymol blue. McConkey mein kya color aaya tha? Lactose fermentation, pretty pink plant. You got a pink color. What did you get with Cled? You got a yellow color. Better kaun sa hai? Cled is better. Why? Because it is less inhibitory. It will allow gram-positive and gram-negative organisms to grow. This is a very famous PYQ, which is better out of McConkey and Cled. Cled is more comfortable. It allows everyone to grow. So Cled is what I'm going to use. Coming to the next, there's another one called eosin methylene blue, and you can see lactose fermentation में क्या आया? Ma'am, कुछ ऐसा brown, blue black stuff है. But there's a green area, a green halo, like God is there. You know, it has an aura around it. That is eosin methylene blue. So you say that colony can be of any color, but that green sheen around it is very, very characteristic, and that is eosin methylene blue. That makes up the three media that you have for lactose fermentation. Now, the first member that I'm going to discuss in this family is going to be E. coli, and you can see that E. coli causes a lot of things in our body, but it causes two main things: diarrhea and UTI. These are all the diarrhea wala strains that I'm going to discuss for E. coli in front of you, and you will realize entero something E. coli. So entero something E. coli. Entero some alphabet E. coli. So that entero E. coli remains the same. Now I just have to see what is it in between that they are talking about. So please note over here, entero pathogenic E. coli, P for P, what does it cause? It causes P for pediatric diarrhea or infantile diarrhea. Entero P for pathogenic, P for infantile. How does it cause? Another P coming up your way. It causes it by bundle forming P for pili. How is it coded? P for plasmid. How simple. Pediatric diarrhea or infantile diarrhea is caused by enteropathogenic E. coli, which is going to form bundle forming pili, and those are plasmid coded. And please note, this enteropathogenic E. coli shows you attachment, effacement, lesions. You can see this is a previous year AIMS question. You can see the bacteria has come and attached and effaced. Effaced matlab thoda flat ho jayega. So when it comes and attaches to the intestine, it's gonna efface it out. Okay, how have I learned it? Is attachment to bachon se hota hai na. You have attachment with kids. So this pediatric wala thing is gonna result in the famous attachment, effacement, lesions. Coming to next. Enterotoxigenic E. coli, T for toxigenic. So this will cause something with T, that is traveler's diarrhea. This causes something called traveler's diarrhea. So when you travel, what do you look at? The colonies, the culture. So how are you going to actually cause this diarrhea? By the colonization factor antigen. This can also cause pediatric diarrhea, but infantile pucha to put it in the P wala. Okay? T for T, traveler's diarrhea by enterotoxigenic. How? By colonization factor antigen. Entero-invasive E. coli, invasion. If something causes invasion, it will cause bleeding, dysentery. So can I say this is very similar to Shigella? Because Shigella also causes, dysentery. This also invades and causes dysentery. If it is invading, matlab, ma'am, this is very dangerous. It has the virulence marker antigen. It has the famous virulence marker antigen. And please note that this virulence marker antigen is the reason that it's invading and causing all that bleeding. So, iska mnemonic kya hai? Invasion se related. Invasion se related, it's causing bleeding, and that means it's very virulent. And tell me one thing, I had told you some test called Serini test, and how did we learn it? We had learned that Serini test because invasive. What did I say? I said Serini test because it is for entero-invasive E. coli, and entero-invasive E. coli ka bhai hai Shigella. So this is gonna be seen in entero-invasive E. coli and his brother Shigella. And what is this test? You have basically inoculated these bacteria into the guinea pig's eye. And what did the guinea pig's eye end up showing you? A lot of redness, keratoconjunctivitis. It started showing you keratoconjunctivitis. So, matlab invasion, man, guinea pig ke aankh mein you are putting needle. It is a very invasive test. So, invasive E. coli is going to be Serini test, seen in invasive E. coli, seen in Shigella. And is this similar test also seen in Listeria? Because if you go back, in Listeria, I have told you Anton's test, which was also a similar keratoconjunctivitis. So, these are the three things that show you the Serini test. Now, coming back, we are done with entero-invasive, going to entero-hemorrhagic E. coli, hemorrhagic. It is going to cause something hemorrhagic, and that is the famous hemolytic uremic syndrome. Hemolytic uremic syndrome, how does it cause? This is what they are going to ask you. This is like, I'm going to make it into a big box because this is very important. What strain? O157H7 causes hemolytic uremic syndrome. And what is the main point? This is SMAC negative. What is it? Sorbitol McConkey agar. So you will say that, ma'am, McConkey was for lactose fermentation. Here you're trying to figure out sorbitol fermentation. Yes, all of them are also sorbitol fermenters. However, enterohemorrhagic E. coli is not going to be a sorbitol fermenter. It is going to be SMAC negative. O157H7 is SMAC negative. Coming to the next, enteroaggregative E. coli. Aggregate hua, if all of us get aggregated, we will persist. So this is going to cause persistent diarrhea. Means I will get a history of a diarrhea which has lasted for more than 14 days. That is what is the history that I'll get. And when everything is aggregated, what will it show on a cell line? It will show the stacked brick appearance. Stacked brick appearance is seen. So sab aggregate ho gaya. Aggregate hua to persistent diarrhea, aggregate hua to stacked brick appearance. The last one is a diffuse aggregative or a diffusely adherent. Rather than the word aggregative, I will use diffusely adherent E. coli, which can also be there. These are all the diarrhea wala strains, and you've seen all their pictures also. Of course, it can cause UTI as well, and you all know the very famous UTI, and you all know, acha, let me ask you that if you have to do the diagnosis of, say now E. coli is causing urinary tract infection, can you tell me what is the cutoff? More than 10 to the power, how many colony forming units is needed? Yes, more than 10 to the power 5 colony forming. If this is there only, then you give the diagnosis of urinary tract infection. And what is this criteria known as? This is known as the CAS criteria. So is there any exception that when someone's urine sample is not showing this much of level, still you call it a UTI? Yes, there are 3 exceptions. I hope you remember the exception was SPA. What is SPA, guys? If, for example, you have done a suprapubic aspiration, then this 10 to the power 5 is not important. Even if you get like 10, 100,000 bacteria, that is also significant. Okay, next. If there is any gram-positive organism, like if the UTI is caused by Staphylococcus aureus or gram-positive में fungus भी होता है ना, like Candida, then also you don't have to consider the 10 to the power 5. Lesser is also significant. If the patient has consumed any antibiotics, or for that matter, if the patient has any diuretics, or the sample matlab diluted urine hoga na, under all these situations, you do not consider this criteria. These are exceptions, guys. Please note, suprapubic, gram-positive, antibiotics and diuretics. These are exceptions to the CAS criteria. What is CAS criteria? That 10 to the power 5 colony forming units se zyada. Let's move on, guys. The E. coli story is done. I'm going on to the next one. And what are these? The different types of Klebsiella that you have. Quick one word you will tell me. Klebsiella pneumoniae, which is known as the Friedlander's bacillus, of course causes pneumonia. Of course, it can cause meningitis and other things also. But this Klebsiella, tell me, K wala word hai. So is it a lactose fermenter? Of course, on a McConkey agar, you will see a lactose fermenter. So what is the color? Pretty pink plant. I will see a pink color. You will say, ma'am, E. coli was also lactose fermenter. KK wala words. Klebsiella is also lactose fermenter. How will you differentiate? Because Klebsiella, please note, is going to be having a capsule. K wala sound. ठीक है, हिंदी याद करते हैं. K. Klebsiella is going to be capsulated. Anything that is capsulated is going to not only show you this colony, but it's going to show you a mucoid colony. Thoda shiny. Can you see this has that whitish as a flashlight chal raha hai, there's a shine. If I try to pick it up, वो mucoid है ना, jelly है. So this is going to be very stringy. So sometimes it is said that this is going to show you the string test positive. That is what it shows you. They say it shows you the string test positivity because it's very mucoid. If you pick it up, it's going to be thready. That is Klebsiella pneumoniae or Friedlander's bacillus. Coming to Klebsiella ozaini. Of course, it causes ozaini. And what is ozaini in ENT? It is a case of atrophic rhinitis. And what is atrophic rhinitis, guys? It means that the person is not going to smell anything. He will say, I am having anosmia, but everyone around him is like disgusted. Why? Because, oh my God, there's a foul smelling discharge. There's a foul smelling discharge. So, right, that is how the common public, is gonna react to him. So we say merciful anosmia, right? So that means that the person that cannot smell anything, but others can definitely smell because he's having a foul smelling discharge. That is ozaini or atrophic rhinitis. Coming to the next, rhinoscleromatis. Of course, Klebsiella rhinoscleromatis will show you rhinoscleroma. No points for guessing that rhino matlab this is going to involve the nose, and the nose is going to look very woody, very hard woody nose is going to be there. And this microscopically shows you 2 things. What are the 2 things? Have a look at this picture, guys. Number 1, it shows you big cells which are very foamy. Foamy matlab ma'am macrophage hoga. Yes, miculic cells. What do you see in rhinoscleroma? In rhinoscleroma, you see the famous miculic cells which are nothing but foamy macrophages, right? Inside them, you will also see the presence of these pink bodies, and those are referred to as Russell bodies. You know this. Russell bodies in pathology were seen in multiple myeloma, and that was immunoglobulins, isn't it? Same thing. तो ये भी तो disorder है ना, bacteria है, antibody you will make, correct? And those pink bodies are Russell bodies. So please note that you see the presence of the miculic cells and the Russell bodies in rhinoscleromatis. Finally, Klebsiella granulomatis. You know this causes donovenosis, right? What is donovenosis? You are gonna see 2 very important things. Firstly, genital ulcer. What kind of genital ulcer? Painless ulcers in the genitals. These are painless genital ulcers, and this shows you the Donovan bodies. How do the Donovan bodies look like? They show you the very classical safety pin appearance. That is what they are going to show you. Let me show you a picture. These are the Donovan bodies that you are going to see over here. And please note that you can see there's a big cell called a macrophage and inside them I can definitely see these safety pins lying. So what is a safety pin? If I draw a safety pin, guys, you will see that there is one area over here and one area over here. So safety pin appearance can also be said as the bipolar staining, and that is a very famous name given for it. Safety pin appearance is known as bipolar staining. तो कौन सा stain है? We can have a couple of stains. One of them is the right Jimsa stain, which is commonly asked. There's another one called the Vezin stain that they can ask, especially because other organisms also show you safety pin appearance. So now you're going to tell me what all organisms show you safety pin appearance. तो कैसे याद किया था? We are going to make a safety pin over here and all of you are going to make letters around it. So सबसे पहले I can extend this and it can become a V. So I can see it in Vibrio parahemolyticus. It can be seen in Vibrio parahemolyticus. Then out of this V, I can also make, instead of a V, I can make a Y over here. Ma'am, you can also make a Y over here. Correct. This can be seen in Yersinia pestis. That is going to be plague. Fine. Let's look at the other one. I can make a D out of it. If I make a D out of it, means I'm seeing which Haemophilus? Of course, Haemophilus ducrei. I can also make a B out of it. So that means I'm talking about Burkholderia, Burkholderia malai, Burkholderia pseudomallei. And finally, I can make a K out of it. So I have that in front of me. Klebsiella granulomatis. That also shows you the safety pin appearance. We'll do a quick recap with V, Vibrio parahemolyticus, with Y, Yersinia pestis, D say Haemophilus ducrei, B say Burkholderia malai and pseudomallei, and K is going to be Klebsiella granulomatis. All of these show you the safety pin appearance. Coming back, the Klebsiella family definitely comes to an end to us. Don't worry about the genital ulcers, which is painful, painless. In a while, towards the end, I will give you a full summary of that. This one is painless. Learn that for the time being. Let's move forward to the other member of the family. That is just one word that you have to know. For Serratia marcescens, that is what you always say. And it has a lot of tongue twisters. So, sabse pehle to marcescens is a tongue twister, Serratia. But I'm going to focus on the R's. Serratia. So this is RR. What is RR? RR means it's going to produce a red pigment at room temperature. You can see the red pigment being made on the culture plate. And that red pigment, when someone, for example, has pneumonia, pneumonia with Serratia, that person will have sputum. On that sputum will start looking red. These patients have pseudohemoptysis. So what is this pigment known as, guys? P say protogeosin. It is going to be protogeosin. So please note that someone doesn't actually have blood in the sputum. It looks like blood in the sputum, pseudohemoptysis, because there's a red color pigment being produced by Serratia. So this is what you have to know. I hope you also remember, this is for INICET students. Can it be a control for something? Yes, it can be used as a control for filtration also, because the size is small, so it can be used as a control for filters as well. Let's move on to the next one. Guys, the next organism, any guesses? What am I going to teach you? If I have shown you swarming, of course I'm going to teach you Proteus. Now, there is not much about Proteus that I have to teach you. First, let me teach you, then I'll come back to that picture. First and foremost, when I say Proteus, have I told you us means it is urease? Is it a part of that punch kiss mnemonic? Yes. Next, I'm telling you that us or simple S is going to remind you of swarming, and that is what we have in front of us. What is swarming? Swarming is something which is a concentric growth. It's a growth. People call it motility also. I prefer to call it growth because it's a concentric growth that you see. And where all do you see swarming? Swarming is seen in PVCs. What is PVCs? Jaldi se give me a full form. P for what? Proteus. V kaun sa wala P? V. Ma'am, go back to the P. It is Vibrio parahemolyticus. Any other Vibrio that can show it? Yes, Vibrio alginolyticus can also show it. So Vibrio parahemolyticus and alginolyticus. Then C, Clostridium. Clostridium tetani, and एक bacillus भी है जो C से है, serious. Bacillus cereus can also show it. And finally, right now I was teaching you Serratia, that red color wala organism, that can also show you swarming. So remember, Proteus, Vibrio parahemolyticus and alginolyticus, Clostridium tetani and Bacillus cereus, तो सारे C wala things, right? And finally S for Serratia. That is going to show you this round and round and round motility. But out of these, did you notice? For Proteus, I said that there is a phenomena that you see called Dine's phenomena. What is Dine's phenomena? Have a look at this picture. I can see one organism swarming from here and one organism that is swarming from here. So this is what you do for Proteus, guys. This is referred to as the Dines phenomenon, and please note this is done for the epidemiology of Proteus. And this I can't write and explain, I'll just explain it verbally because it's a story that I have to tell you. If you have a 10 people in the ward who have Proteus, how will you know that all of them have the same Proteus, or they have different types of Proteus? So if you put one Proteus over here from patient A and one Proteus over here from patient B, both of them will start swarming. तो अब simple है, if they are same, मतलब best friends हैं, they will come and hug each other, the swarmings will merge. If they are enemies, अलग-अलग हैं, they will come, but they will suddenly show a distinguishing, they will repel each other. So can I say, यहाँ पर ध्यान से देखो, are these lines meeting like this? Are they all merging into each other? No, I can see that they have made their territory very clear. There is a line of demarcation. So simple. What do you see in Dines phenomena? If the swarming is going to merge, if the swarming will merge, this means they are same strains. And if there is a line of demarcation that you notice, then that line of demarcation is going to mean that they are different strains. That is how you say that this is only and only used for Proteus. Remember, Dines phenomena is only for Proteus, not the other PVCs that I have mentioned. So yes, that is Dines phenomena. But note, it is different from what we call as the Dines stain. Please don't get confused in the paper. Dines stain is what we use for mycoplasma. That is totally different. What else does Proteus have? It is phenyl pyruvic acid test positive, yes. And whenever there is Proteus infection, the odor tends to be a little fishy. So yes, these are the things about Proteus that you're going to get in the paper. Done with Proteus, PPA positive, phenyl pyruvic acid test, then along with that Dines phenomenon positive, reaction kaun sa ho sakta hai? I've told you, it is going to show you the PPA reaction. Done. O for odor, fishy odor, S for urease, punch kiss mnemonic mein tha, and S for swarming. If I now go on to the next organism, which you can see in front of you in this family, is going to be Shigella. Now tell me guys, in Shigella, as you can notice over here, there is Shigella dysenteriae, flexneri, boydii and soni, out of which we say the world is sleeping and India is very flexible. The world is sleeping means soni is most common in the world and India is flexible, flexneri is more common in India. Also, I hope you remember, all of them were non-lactose fermenters. All of them were non-lactose fermenters, but soni so late utha na, sota raha, late utha, late lactose fermenters. Now let me add on to the story. All of them are going to be catalase positive and all of them are going to be mannitol fermenters. But this Shigella dysenteriae, which causes the most dysentery, blood wala, ye alag hai. This is a little dark, a little different in life. It is catalase negative and it is a non-mannitol fermenter. That is what you have to know. This Shigella dysenteriae is very different, right? So what is the disease that I'm talking about over here? Obviously, when I'm talking about Shigella dysenteriae, I'm talking about blood in the stool, I'm talking about dysentery. So do you want to ask me the mechanism of action? Ya chalega? I think chalega, because I know for a fact that all these Shigellas, let me quickly ask you, do you remember what were the organisms that decrease protein synthesis? I have taught you that so many times, I don't want to repeat. So I had told you diphtheria toxin, Pseudomonas, Shiga and Shiga-like toxin, they decrease protein synthesis. How were Shiga and Shiga-like toxin decreasing protein synthesis? By inhibiting the 60S ribosome. So I think all of you know this and I don't have to actually explain this over and over again. Okay. Now we come down to how will you do the diagnosis of this dysentery. So firstly, if whatever I am teaching you for Shigella, remember there are some sisters called SS sisters, Shigella and Salmonella sisters are there. So whatever I'm teaching you for Shigella, please copy paste that in Salmonella also. Firstly, what do you do? For Shigella, we use the Sachs buffered glycerol saline. So we use the Sachs buffered glycerol saline that is basically used for the Salmonella Shigella sisters in their transportation. Now we come to enrichment media. We have two enrichment media, the broths. We have something called selenite F broth and we have tetrathionate broth. These are the two broths that I'm going to use. Broth matlab liquid na, enrichment broth matlab something liquid. So these are for both Salmonella, Shigella both. But selective media is a long list. There is something called XLD. Everywhere D means deoxycholate. There is called DCA, again deoxycholate. SS to naam hi rakh diya, Salmonella, Shigella, agar for the sisters. And HE is hectin enteric. Enteric fever मतलब salmonella ना, तो salmonella, shigella दोनों के लिए. These are the selective media of which you get a question on XLD and DCA a lot. So I realized the salmonella sisters के लिए, salmonella shigella sisters के लिए SS, Sachs buffered glycerol saline. Then the S for selenite F broth is also important. And ये सारे D वाले, that is XLD, DCA, SS for salmonella shigella, enteric for salmonella shigella, all of these are going to be the same. I will tell you in a while that something is going to be different for salmonella, which I'll tell you. But yes, for the time being, tell me what is the treatment of this shigella. For the treatment of shigella, you have to go in for ciprofloxacin. So salmonella par jab aayenge, then I'll tell you the difference over there. So let me quickly start off with salmonella also. Salmonella matlab kya? Salmonella means enteric fever. What are all the features that you see in typhoid fever? A quick review of all the medicine aspect. Guys, what fevers? Step ladder pattern fevers. 1. Rise, stable, rise, stable, rise. Step ladder pattern fever. Yes, not step ladder electrophoresis pattern, because that was in pathology. The step ladder electrophoresis pattern in pathology was seen in apoptosis. Okay, just a very random correlation. But step ladder fever, salmonella, enteric fever. What kind of ulcers in the GIT does it cause? Longitudinal ulcers. They are going to be longitudinal. How did we learn it? Tie, typhoid. Tie सीधा होता है. Tie is worn in a long axis. So typhoid ulcer is going to be learned as a tie, longitudinal. What kind of diarrhea? Pea soup diarrhea. Then we have a very famous sign called the Faggot sign. Faggot sign matlab that this patient has fever. Of course, typhoid hai, fever hoga. In every fever, I expect that the heart rate should go up. But here there is bradycardia. The heart rate dips, and that is referred to as the Faggot sign. Moving on to, yes, there can be a soft palpable spleen liver, hepatosplenomegaly ho sakta hai. And there are some very famous spots called the rose spots. Rose spots are seen usually in the second, third week, and if you apply pressure on them, they are going to fade. These are all the features which you know from medicine about salmonella. And now I can conveniently say that salmonella mein sab kuch shigella wala tha. So if I ask you, everything over here of salmonella shigella was the same. So now whatever I have taught you, sab kuch as it is, you are gonna erase the shigella from here and you're gonna add the salmonella now over here. But guys, please note that for salmonella, there is something called as the Wilson and the Blair media. There is something called the Wilson-Blair media, and Wilson-Blair media shows you jet black colonies. So finally, this is only for salmonella. This is a selective media only for salmonella. So remember, salmonella and shigella were sisters. From transport to enrichment to selective, सब कुछ साथ में चला. But who ended up creating a rift between the sisters? There's a boy named Wilson. Wilson came and the two sisters got separated. So salmonella said, I am going away with Wilson, but that was a black day. Sisters should never be separated. So salmonella को किसने ले लिया? Wilson has separated her from her sister, and that is a very bad thing to do. So jet black colonies is what it's gonna get. But how else do you do the diagnosis of typhoid fever? There's a very, very famous mnemonic known as the BASU. So quickly, how did we make a mnemonic called BASU? Depending on which week the patient has come to you in. Week 1, 2, 3, 4. So sabse pehle, if the person has come to you in week 1, you know you're gonna do a blood culture, right? If the person comes to you in week 2, you will do antibody testing, and that is very famously known as the Vidal test, which I'll show you a picture of. In week 3, you will do a stool culture, and in week 4, you will do a urine culture. These are the 4 things that you can do. Overlap hota hai. It's not exactly 1 week, 2 weeks. There can be overlap, but this is for learning. So BASU, blood, antibody, stool, urine. Out of that, you know, this antibody or this Vidal test is very, very important. Before I tell you the Vidal test, I have to tell you the concept of that the typhoid or the enteric fever or salmonella, whatever you want to call it, they are made up of 2 antigens called the O antigen and the H antigen. Remember, O antigen and H antigen. What are their other names? O antigen is known as the somatic antigen and H antigen is referred to as the flagellar antigen. This you know from your general microbiome. Now, please note that when I say O antigen, this is the same for all the salmonellas. For Salmonella typhi, for Salmonella paratyphi A, for Salmonella paratyphi B. So tab का क्या मतलब है? I'll repeat it again. It is the same for Salmonella typhi, for paratyphi A and for paratyphi B. It is the same for all of them. ठीक है, तो whether I get O antigen positive reaction, I will never know which kind of typhoid is it. But flagellar antigen is different. Typhoid का flagellar antigen अलग, paratyphi flagellar antigen separate, and paratyphi B का flagellar antigen is separate. So when I'm going to do a Vidal test now, finally, when I do a Vidal test, you will see that TO is written, but that means ये O antigen तो सबका है, typhi, paratyphi A, paratyphi B, just one common. Whereas H antigen is written thrice. Why? Because the H antigen for typhi, for paratyphi A and for paratyphi B are different. So now tell me, if you get a reaction, what are you trying to test? Vidal mein what will you take? You will take a blood sample. And what are you trying to test? Does my patient have antibodies? ठीक है, तो in my lab I have kept these antigens and from the patient I'm taking antibodies. Let me see reaction हुआ या नहीं. Yes, with O antigen I got a reaction. But will I get to know whether it is typhi, paratyphi A or paratyphi B? No, I just got to know typhoid है. कौन सा typhoid है? I will have to do this. I got a reaction with typhi का H. This means this is a case of Salmonella typhi. Second scenario, O antigen मतलब typhi है. O antigen reaction is there, typhi is there, and A वाला flagellar antigen has come. Paratyphi A is the infection. Next, O antigen के साथ testing है, typhoid तो है. Which typhoid? Now H tells me that it is paratyphi B. So first everyone's understood how to do the diagnosis. O तो will come in every case. Where has the reaction antibody to the H antigen comes, that is going to make a difference. Now remember, if only and only, now you're going to learn a mnemonic called OH. OH. So please note that in Salmonella typhi, if you have to read a report, which appears first? O antigen के against antibodies. Next, which appears second appearance, that is against the H. Then how do they disappear? Again OH. Who disappears first? It is going to be antibodies against O. And who disappears last is going to be antibodies against H. So what did I say? OH. First this will come, then this will come. First this will go, then this will go. So if I say only antibodies against O are seen, only antibody, abhi H आया ही नहीं. So you will say, ma'am, this must be some very early infection because this is the first one to appear. Whereas if I say there are antibodies only against H, या तो typhi वाला H or paratyphi वाला H or paratyphi B वाला H, whichever, anyone H is there, only H is remaining. Only H is remaining, everything else has gone. So you will say, oh ma'am, this is probably the last part of the infection that you have. And finally, what do you have for vaccine? So please note, for vaccine, O is never there and all the H's are there. And what is the concept behind it? Because Salmonella has a third antigen called VI antigen. VI antigen is something that covers O. So if this is O, VI is going to come and cover it, which means that antibodies against that O to cover ho gaya. Antibodies against O will never be formed, but antibodies against all the H's will be formed. And that is what you see in a case of vaccine. So remember, vaccine ka VI, this is the antigen that you use for vaccination. Now guys, I want to tell you that although I taught you OH, but there is a controversy over here. You know why I taught you OH? Because that is how you do the reading of the report in the paper. However, if someone asks you a simple one-liner, thoda controversy hai, dhyan se sunna. If someone asks you which is the simple one-liner, that is, which is the most immunogenic antigen and which is gonna give you the earliest and highest antibodies. Earliest and highest antibodies, remember the answer is H. You will say, ma'am, abhi to you said O appears first. Yes, that is only for reading of your report. But remember, if a single one-liner comes, because H is very, very immunogenic, it's said that it can appear and it should ideally appear first in the blood. Okay, so your Basu mnemonic is done. Do you want to see how a Vidal test looks like? It's a slide test. It is a kind of a slide agglutination test that you have. You can see that there are some. Tell me, kahan agglutination hai, ma'am? O mein agglutination lag raha hai, ... So this must be typhoid. Kaun sa wala typhoid? So I can see H may be agglutination hai and paratyphi A may be agglutination hai. So these are just different scenarios. So if H was here, it must have been typhoid. If AH mein hota, this must have been a case of paratyphi A. If BH would have shown you, it must have been a case of paratyphi B. NCPC are negative control, positive control. Again, not important for you to know in the paper, but you need to know how to make your diagnosis. So, jahan bhi aisa ... dikhega, this means the agglutination test has occurred. But again, let me tell you, is Vidal specific? Not at all. Vidal is a non-specific test. Let me tell you, in cases of COVID, Vidal test used to come positive. It's a non-specific test. So, you have to not rely on one testing. You have to do serial testing. You have to repeat the test again. Only if the antibodies keep on rising, then you will say, yeah, this is a case of typhoid. One test is never diagnostic for it. Okay, on that note, now we have newer tests called Typhi dot and dot blot. They also measure the antibodies. They are card tests. They are rapid, more rapid in comparison to Vidal. So you should just know their name, Typhi dot and dot blot. Finally, if I want to end, did I tell you for Salmonella and Shigella, everything was the same. The enrichment broths were the same. The selective media were the same. But who finally split up the Salmonella Shigella sisters? They were split up by the Wilson boy. This Wilson boy, very dirty boy. He has created a very black history. What has he done? He has separated the sisters. This is the only one which cannot be used for Shigella. So remember, Wilson is gonna go with Salmonella. Wilson is gonna go with Salmonella. What color colonies? I told you, no, very bad thing he has done. Jet black colonies for Salmonella. That wraps up Salmonella for all of you. Salmonella, Shigella ho gaya. Now we move on to the next member of the family, last one, that is Yersinia. Let me first tell you, you must have heard of Yersinia pestis, enterocolitica and pseudotuberculosis. अब इनमें से कौन कहाँ जाता है? Yersinia pestis is what you call as plague कराते हैं ना, rat वाला plague. That doesn't come in the Enterobacteriaceae family. Enterobacteriaceae family includes enterocolitica and pseudotuberculosis. Together they are known as Yersiniosis. Yersiniosis comes in the Enterobacteriaceae family. I'm going to study this first because what do all of them cause? Both of them are associated with gastroenteritis. Because their word is only telling me na enterocolitica. So both of them cause gastroenteritis. They are the ones called Yersiniosis. They come in Enterobacteriaceae family. Plague does not come in the Enterobacteriaceae family. So please note, if I have to differentiate between them, Yersinia is non-motile. But these two people who have made a pact, these Yersiniosis, they are saying that we will show a different type of motility. They say that we are going to be motile at 22 degrees centigrade, but we will not be motile at 37 degrees centigrade. Does this remind you of any other bacteria? So remember, ये वाला जो motility होता है, this is referred to as the differential motility, where it says I will be motile at one temperature, not at the others. And this is seen not only in Yersiniosis, this is also seen, before I told you, Listeriosis. And I told you Listeria was the tumbling tully man, remember? So I told you that you can be drunk at a young age of 20 to 25, but you will not be able to consume that amount of alcohol at 37 because you have aged and your liver is starting to give up. So this is motile at 22 but non-motile at 37. That is something which you see with Yersiniosis and Listeriosis, and that is a differential motility. So this is what you need to know about Yersiniosis. Plague though is not at all motile. What about their urease test? Remember, Yersiniosis is going to be urease positive and the plague is not interested in all these things. Now, if I ask you, how are you going to do the lab diagnosis? Another commonality that I'm going to find between Yersiniosis and Listeriosis is that they show you cold enrichment. They also show you, both of them show you cold enrichment. That means that if you will grow them at normal temperature, so they will grow. But if you put them at a cold temperature, they'll be very, very happy. So remember, for the diagnosis of Yersiniosis, especially Yersinia enterocolitica, they will grow at a normal temperature also. But if you grow them at 4 degrees, they are very happy. Cold enrichment, like I said, cold enrichment is not only seen in Yersiniosis, it is also seen in Listeriosis. So in Listeria or Yersinia ka kafi acha pact hai. We will both show differential motility, we will both show cold enrichment. Coming back, if I talk about Yersiniosis, especially I said Yersinia enterocolitica, it has a very famous family called the bullseye appearance. You can see there's a dark center and a lighter area. There's a bullseye appearance on which agar? There is going to be a CIN agar that is used for Yersinia. So bullseye appearance is noted. Everyone's clear with Yersiniosis, enterocolitica and pseudotuberculosis? Because I'm talking about Yersinia, to khatam karte hain na, although it's not a part of this, but let's finish off plague also. What is plague? So as I said, plague is something which is caused by Yersinia pestis, and I think everyone knows that this is something related to rats. And how is the transfer going to occur? The vector is going to be the rat flea. This much information everyone knows. Okay? So what are the types of plague? Rat bite se hota hai ya rat flea se hota hai. So what are the types of plague? Bubonic plague, in which of course buboes are there. Buboes क्या होता है? Painful lymph nodes. So painful lymph nodes are there, of course. That is buboes. Count the alphabets. It has 7 alphabets. So how many days is it going to take for incubation period? 2 to 7 days. Similarly, there's something called pneumonic plague. Pneumonic, ma'am, pneumonic मतलब lung involvement. Lung involvement हमेशा जल्दी होता है. It's going to happen very jaldi. So the incubation period is very short, 1 to 3 days, and that is the reason that this is a bioterrorism agent. Coming to the last one, there is something called septicemic plague. Either bubonic can change to septicemia, pneumonic can change to septicemia, anything can change to sepsis. Na? So that also has a 2 to 7 days. So if I write sepsis, that also has roughly 6-7 alphabets. Na? So 2 to 7 days is going to be the what? The incubation period. And please note that this is what we call as Black Death. You must have heard Yersinia pestis or plague is referred to as Black Death. So how is it going to look like? If you remember, sometime back I told you that this shows you the very famous safety pin appearance. Kuch yaad aa raha hai? I give you a mnemonic quickly. I'm not going to write it again, but I'm going to make you revise. What all shows you safety pin appearance? Ma'am, you made a V first, Vibrio parahemolyticus. Then yes, ma'am, you made a Y also. You said कि हाँ Yersinia pestis exactly in front of you. Yersinia pestis. Then you made a D, Haemophilus ducrei. You made a B, Burkholderia, and you made a K, that is Klebsiella granulomatis. All of that, and yes, Yersinia pestis is in front of me. It can definitely show me the beautiful bipolar safety pin appearance. Now tell me, if I have to grow this on a culture media, so what is it? That is going to be the ghee broth. And on a ghee broth, like ghee, you must have seen if your mother puts ghee in your food. So you see ghee as a drop by drop aata hai. So can you see something dropping down? On ghee broth, it shows you a stalactile growth. It shows you a stalactile growth on a ghee broth as if something is falling down. That is very important for Yersinia pestis. I hope you all remember safety pin to pehle bhi pada hai, copy paste it over here. Now I've taught you the stalactile growth on ghee broth, which is much expected, and that definitely wraps up all of your most important Enterobacteriaceae family. Now what you will do, you will go back to that first table that I gave you, revise that, and your entire summary is done. Let's begin with the next family, and that is the Vibrio. We all know that Vibrio is divided, although we are most important one is Vibrio cholera. But before I get on to the cholera aspect, I think I would want to tell you that Vibrio is divided into two families. The ones which are salt loving, known as halophilic, and the ones which are non-salt loving and cannot grow on salt. And actually you would realize Vibrio cholera and Mimicus comes under this. All the others like Parahemolyticus, Alginolyticus, Vulnificus, they are all salt loving. So all these us, that is Parahemolyticus, Alginolyticus, Vulnificus, they are in love with salt. They need 7 to 10% of salt. Cholera and Mimicus do not need salt. So remember, cholera has two different types of strains that are circulating. We have classical and we have L-tor. And the method of learning this is L-tor is everything. L-tor is going to be everything resistant. So if I ask you, what is the polymyxin B sensitivity? You will say it is resistant. Phage 4 susceptibility, it is going to be resistant. Versus if I ask you any test, everything is coming positive. Beta hemolysis, yes. Chick erythrocyte agglutination, yes. VP test, again, yes. Whereas classical is everything sensitive and negative. Bilkul opposite. Sensitive and negative. So simple. L-tor yaad kar lo. L-tor is the one that is everything resistant and everything positive. Also, please remember that what are the carriers going to carry? Carriers for Vibrio cholera carry the L-tor strain. Okay, this is your basic. Before I start off with Vibrio cholera, I think all of you know what is the disease that it causes. So, agar patient ka diagnosis banana hai, so first you will say that let's talk about the clinical history. Clinically, these patients land up with the very famous rice water stools, right? Rice water flaky stools, and rice water diarrhea is what is there. But how does rice water diarrhea happen? Because of an increase in which mediated pathway? Cyclic AMP. So now you would want to know that what are all the conditions that increase cyclic AMP. We'll have a mnemonic for that so that I don't have to repeat it again and again. Hai na? So cyclic AMP ka mnemonic is cyclic AMP only. How convenient. So what is the C? Obviously the C means cholera increases cyclic AMP. What is A? If you remember, in case of anthrax, Bacillus anthracis was also increasing cyclic AMP. M को I'm going to turn it a little and make it E, because please remember, enterotoxigenic E. coli. Toxigenic E. coli was causing what? Traveler's diarrhea. That also increases cyclic AMP, and that is which toxin? The labile toxin. Because you will say that, ma'am, you didn't teach us over there in the rapid revision, you have not taught us. Labile toxin matlab there must have been a stable toxin also. Yes, I will come to that, but abhi ke liye remember labile toxin. And P for pertussis, whooping cough. So remember guys, please note cholera, anthrax, E. coli, enterotoxigenic E. coli and pertussis, because now I will tell you the next part of this mnemonic. तो क्या करा था? Cyclic AMP में बस M को turn कर देना, तो CAEP is your mnemonic over here. So now we need to know the difference between cyclic AMP versus cyclic GMP. So please remember, in E. coli, enterotoxigenic E. coli for example, we will learn it, and I had told you one mnemonic that it is going to be labile in the air. When someone is very labile, he is going to be flying in the air, and when someone is very stable, he is going to be stable on the ground, है ना? So remember that cyclic AMP अगर बोला है, so which toxin is there? It is the labile toxin. And if cyclic GMP is written, then which toxin is there? It is the stable toxin. That is the first difference between AMP, GMP you have to know. First is, next one that you have to know is, you must have heard, and I have taught you in Bacillus cereus, that there are two types of food poisonings that it causes. The number one food poisoning is going to be the one which is diarrheal, in which patient has diarrhea, and the other one is the one in which there is emesis, there is vomiting. So remember that diarrhea goes out from the anal canal. Diarrhea is going to go out from the anal canal. This means cyclic AMP is elevated in it. Whereas emesis, vomiting, is going to happen from the gala. Gala basically means that cyclic GMP is going to be mediated in it. These are the two differences between AMP, GMP you have to know. So for E. coli, please remember labile in the air and stable on the ground. And for Bacillus cereus, please remember diarrhea through the anal canal and vomiting is going to happen from the gala. That wraps up. Coming back, why did I teach you? Because cyclic AMP, C for cholera. So how are you going to do the diagnosis? Firstly, whatever stool sample that you have, you're going to put it in a transport media. There is a VR media which is a transport media, and also a Carrie Blair media which is used. Venkatraman Ramakrishnan medium and Carrie Blair medium, ये दो scientist वाले are the transport media. What are the culture media? There's a famous culture media called TCBS. I'll actually show you the picture straight away. Have a look at this. When you're talking about Vibrio, you must be noticing that Vibrio is going to be what? It is going to be a comma-shaped organism. And now that you've told me this, tell me the motility also. Motility में क्या आता है? It's the very, very famous darting or the shooting star motility. Darting or the shooting star motility. And this is also shown, other than Vibrio, who else shows it? It is also shown by Campylobacter. So that is the darting or shooting star motility. Okay? So comma shape organism, and you can see that yes, beautiful comma shape organism that I can notice over here. Now what is the media? I told you I grow it on a TCBS. I hope you remember the full form of TCBS. It is thiosulfate. Just quickly you go through it once. Thiosulfate citrate, bile salt sucrose. Bile salt sucrose. Basically it tells me of sucrose fermentation. So guys, when sucrose is fermented, what is the color that you get? You get a yellow color. Color change हो रहा है. So ma'am, they will ask me what is the indicator? Bromothymol blue is going to be the indicator. That's again a very, very important question that you have. Bromothymol blue is the indicator. So repeating all this once again, if you go to the culture media, I have given you a list that all the fermentations are going to give you a yellow color, but which was the only fermentation which gives you a pink color? That was McConkey. We've done that summary table also. So coming back, please remember Vibrio cholera is going to be a sucrose fermenter. Vibrio parahemolyticus is a non-sucrose fermenter, because I don't see any yellow color over here, and that is the sucrose fermentation that I did. What will I do on get on a gelatin stab? So please note that you can't consume rice alone. Rice के साथ कुछ vegetable needed है. So which kind of liquefaction do you notice? You see a turnip or a napiform liquefaction. You see a turnip or a napiform liquefaction that you see. So simple. For rice, you also need a vegetable. And now you will say, ma'am, you are having rice, you are having vegetable, but did you pay for the bill? Exactly. If you want to eat rice and if you want to eat vegetables, where are the coins? Where is the money? So Vibrio is going to be coins positive. That is your mnemonic. For the rice and for the turnip, give the money. Number one, cholera red reaction is positive. What is the red color because of? There is a compound form called nitroso-indole compound. Previous year question. Red color of cholera red is because of nitrosoindole compound. Next, it is catalase positive. It is also oxidase positive. IN for it is indole positive. N alone for nitrate reduction positive. S for sucrose lysis and S for string test. ठीक है, तो जल्दी से cholera red, catalase, oxidase, indole, nitrate reduction, sucrose lysis, string test. It is Cohen's test positive, and that is the string test that you have in front of you. Now, there are a couple of things that I want to discuss with all of you over here, and one of them being, okay, this cholera you just said is oxidase positive. So, can you now tell me a list of everything that is oxidase positive? Correct. Like you said over here, V is going to be for Vibrio cholera. Similarly, now in a while I will be teaching you an organism called Pseudomonas, and that is also going to be oxidase positive. What I have already taught you earlier is Neisseria. Neisseria is also oxidase positive, and in the end I will teach you two bacters. One is a Campylobacter and the other one is going to be a Helicobacter. These are all oxidase positive. So instead of learning punch, we have learned P वंश वाला. ठीक है, so now remember urease के लिए the mnemonic was punch kiss. अब देखो mnemonic का भी mnemonic we will have to do. For urease it is punch kiss, whereas for oxidase it is the same punch but the punch is a spelling change with a V. You don't have to get confused over here. So yes, Vibrio is going to be oxidase positive because it's a mnemonic of the punch V wala punch that you have, right? Lastly, what is this string test? So as I told you, string test is that the rice water stools are now going to become stringy. So please note, where all can you see a string test? And there are three places where you have to make a summary of it. Number one, the string test is seen with Vibrio cholera. Sometime back I told you there was a stringiness that was also seen with the mucoid colony of Klebsiella. And is there a string test that you do in a patient in case of parasitology? Yes, string test is also for Giardia lamblia. Again, something 3 ways string test is going to be very characteristic for you. Let's move forward, guys. These were all the Vibrio cholera ka features. But what about the salt-loving organisms? Parahemolyticus, Vulnificus and Alginolyticus. What about these? So please note, algino. Algino we had learned like Chinese food has salt. A lot of salt, high salt content. So which is the most tolerant to salt? Ma'am, Ajinomoto. Ajinomoto hota hai Chinese food mein, and that makes it very, very salty. So this Ajinomoto wala, that is Alginolyticus, is going to be very, very tolerant to salt. Then earlier I had told you which of them show swarming. Remember there was a mnemonic called PVCs, and I told you PVCs mein Vibrio parahemolyticus and Alginolyticus are going to show you swarming. That is a question that I had put up for all of you. Both of them tend to show you swarming, the parahemolyticus and the alginolyticus. So now kya karte hain? See, one thing is there that all of them have a common finding. All of them cause wound infection. So you will say, okay ma'am, that wound is, we heard a muhavra na, jale pe namak. So jale pe namak, halophilic. These are salt loving na, so they are salt loving, so the wound also has to come. All of them have wound infection. Parahemolyticus causes gastroenteritis. Vulnificus can cause sepsis, and Alginolyticus, it is Chinese food na. So Chinese food I told you is very, very salty. Ajinomoto, most tolerant to salt. Chinese food is very, very spicy. So spicy कि कानों में से और आंखों में से धुआं निकलेगा. So these patients are gonna have conjunctivitis and otitis media. So spicy Chinese food, कानों में से आंखों में से धुआं, and very, very salty. So very, very salty and very, very spicy is how I have learnt it. Next, which out of these can show you the Kanagawa phenomena, and that is the parahemolyticus. What is Kanagawa phenomenon gonna be? So for Kanagawa phenomena, if you remember, we were using the Vagatsuma agar. Vagatsuma agar is nothing but a blood agar, and because ma'am these are very, very salt loving, so thoda sa salt dal do, 2 to 4% salt you put for this fellow over here. So you put a blood agar. Now tell me, hemolyticus, you are trying to see blood agar pe kya, whether it is breaking the blood or not. So you will say that if there is hemolysis, if hemolysis is present, this means that strain is working, it is pathogenic, and hemolysis is not seen, this means it is non-pathogenic. That is known as Kanagawa phenomena. Repeating, what is Kanagawa phenomena? You take a blood agar, if it breaks it, it is pathogenic. If it doesn't break it, it is non-pathogenic. What is that agar? Known as Vagatsuma agar, and that is hemolyticus will only show you this hemolyticus wala feature, right? So simple. This is the story of the salt-loving wala vulnificus, alginolyticus, parahemolyticus. Most expected question. Question 1, most tolerant to salt. Ajinomoto, alginolyticus. Kaano aur aankhon mein se dhua, very spicy Chinese food. Conjunctivitis otitis media are a feature of what? Alginolyticus. Super favorite questions. Now we've done with the Vibrio family, so we move on to the next one, and that is the family of the non-fermenters. What does that include? So non-fermenters matlab they are not going to use sugars fermentatively. They will use them oxidatively, not fermentatively. So remember Pseudomonas, Burkholderia ka species, and Acinetobacter baumannii. So remember non-fermenters. I think when I say Pseudomonas, it's very clear that the color coming to your mind is this blue-green color pigment called pyocyanin. What do you have to know? It is a diffusible. Till now, whatever pigments I taught you were non-diffusible. This is diffusible, means everything is going to turn blue-green. It's going to diffuse out everywhere. And please remember, this can basically be enhanced on a media further that is known as King's media. तो किंग में तो मतलब इन किंग्स रूल एवरीथिंग इज गोना बी मैग्निफिसेंट ना, किंग के लिए सब कुछ आउट इज गोना बी वेरी एक्सट्रावेगेंट. सो रिमेंबर फॉर द किंग्स मीडिया द कलर इज गोना बी मोर, इट इज enhanced on a king's media. What are the other colors that this can produce? It can produce a greenish yellow color also, that is pyoverdin. It can also produce a rubin matlab red color. It can produce a blackish matlab melanin, pyomelanin. All these pigments are possible, but pyocyanin, which is blue-green, is very, very famous. Not only this, all the diseases are also going to be blue-green. So very commonly asked is this green nail syndrome, very common. Next, wherever it will cause an infection, wahan green color lagana, blue-green color. So if it says UTI, urine ka color, blue-green. Meningitis, CSF color, blue-green. Burn wounds, you know Pseudomonas is associated with burn wounds infections. Of course, you know it. Okay, next we come to, it can cause contact lens associated corneal ulcers. It can cause pneumonia. Pneumonia matlab sputum ka color blue-green. These names, please learn these fancy names. Swimmer's ears, which is otitis externa. I hope you remember. Then you have hot tub folliculitis, and hot tub folliculitis is also known as the jacuzzi's fever. So because this happens when people taking bath in jacuzzis, then spas. So remember hot tub folliculitis and Shanghai fever. Overall realize ये Pseudomonas का king वाला जो है ना, ये king के साथ काफी fancy it has become used to very rich lifestyle. So it is roaming around in Shanghai, it is taking bath in jacuzzi and hot tubs, and it is also swimming and chilling in life. So swimmer's ear, the king's media wala is enjoying the king, living life king size. So Shanghai fever with the swimmer's ears, with jacuzzi, hot tub folliculitis, and most expected question, green nail syndrome. So I've got you a mnemonic which I taught you in the main lectures, and I think that's the best mnemonic for Pseudomonas possible. So सबसे पहले P is pigments. Have I told you? Pyocyanin, rubin, melanin, verdin, all of them are enhanced on which media? King's media. S for what? This tends to create a sweet or a sweety, fruity odor. Okay, tell me, whenever you will grow it on any media, you know there is E for iridescence. Iridescence matlab aisa shine hoga. There is a metallic shine that occurs. And what media am I talking about? I'm talking about a selective media. Which selective media? For Pseudomonas, the selective media is cetrimide agar. Next, tell me, how does it utilize sugars? Ma'am, non-fermenters hai ye. They will utilize sugars oxidatively. What is MO? They are motile. Only for adding something. We know they are non-lactose fermenters. Are they on agar? Blood agar going to show you beta hemolysis? Yes. And selective media is cetrimide agar. So jaldi se, pigment hai, sweet fruity odor hai, there is iridescence which is going to be a shine. Which selective agar? That is going to be cetrimide. Blood agar pe it is a hemolytic organism. Uses sugars oxidatively. MO for motile and N for non-lactose fermenters. This is the story of Pseudomonas. I hope you also know Pseudomonas has been included in the WHO priority list for nosocomial infections acquired from the hospital. So nosocomial infections which are having multi-drug resistant WHO organisms, कौन से हैं? Escape. They are going to escape the antibiotics. They are going to be drug resistant. They are going to basically be having problem in the hospital, nosocomial infection. So E for what you read in the cocci, Enterococcus fecalis. S for Staph aureus. तो ये दोनों cocci में आ गए. आगे देखो, Klebsiella pneumonia, which is very commonly seen in hospitals. Acinetobacter baumannii, which is a part of non-fermenters. Pseudomonas is also a part of non-fermenters. And Enterobacteriaceae ka species. So firstly, if I talk about the cocci, Enterococcus and Staphylococcus, then all the other come under bacilli. So Enterobacter, Pseudomonas and Acinetobacter, तो same non-fermenters का family है. And finally, we have the Klebsiella. So yes, these are all the WHO priority list of nosocomial infections having MDR. So Pseudomonas is done, right? I've also told you Acinetobacter comes under escape organisms. Now we are left with Burkholderia. There are three Burkholderia that you have to know: Burkholderia malai, Burkholderia pseudomalai, and Cepacia. Easy wala khatam kar dete hain. That is Burkholderia, Cepacia. Alternate alphabets you will take up. So if I ask you which is the most commonly found out of them, that is Burkholderia, Cepacia. Also, if I ask you which is the most potent out of these, that is going to be Burkholderia cepacia. If I say which is also antibiotic resistant, is again this organism. And if I finally say the most important question, which is associated with chronic granulomatous disease and cystic fibrosis, that is also cepacia. So I told you, take up alternate alphabets. Most common, most potent, associated with cystic fibrosis and chronic granulomatous disease, and it is going to be antibiotic resistance, that is Burkholderia cepacia. Now we come to Burkholderia malai. So up confusion, always students have a confusion, malai and pseudomalai, because one is in humans and one is in animals. So I have learned Burkholderia malai is going to be Burkholderia animali. Okay, so that is how you will be learning it from today onwards. It is going to be Burkholderia animali. So you will know that, oh, this is the one that is happening in animals. This is the one that is seen in animals, and in animals it is known as glanders disease. Ma'am, glanders disease matlab kuch glands honge, lymph nodes honge, lung infections, skin ulcers. Yes, all are the clinical features. So this is the one that you see in animals known as glanders disease. And how do you do the diagnosis? Wo bhi animals. There is a diagnosis done by something called Strauss test. Strauss test means if you if you inject this organism in a guinea pig, there is going to be testicular swelling that is going to be seen. So simple. The disease also happens in animals, and the diagnosis is also made by an animal test called Strauss test. So I have learned Strauss for scrotal. Scrotal inflammation hoga. Scrotum matlab testicular inflammation hoga. Strauss for scrotum. This is animali. Disease also animals, diagnosis also animals. Because now when I come to pseudomalai, that is the one that you see in humans. The same ulcers and the pneumonia and everything now in humans. So please note, this is known as melioidosis, and why in humans? This happened during the Vietnam time bomb. With that bomb blast, all the soldiers in that area in Vietnam ended up having the disease. So this is known as the Vietnam time bomb or Whitmore bacillus. Vietnam time bomb, and Whitmore bacillus, that is the one that is going to be showing you this condition. So imagine if there is a time bomb, you will say, ma'am, time bomb, matlab if bomb blast hua, to everything will come down to ashes. If you ask me what is going to be the culture media, it is the ash down agar. It is going to be the ash down agar, because bomb blast ke saath everything comes down to ashes. Versus if you ask me that what is the microscopic appearance, that I've already told you, safety pin. I'll give you one more story. From a bomb blast, you of course need safety. So bomb blast ke saath safety chahiye, and that is what you're going to see over here. And finally, if I say what is the treatment, the carbapenem, imipenem, these are the treatments that you have. And is this sounding quite dangerous? Yes, Vietnam time bomb. Is this associated with bioterrorism? Of course. So always remember, pseudomalai is the Vietnam time bomb. Time bomb will come down to ashes, ash down agar. You need safety against a bomb blast, safety pin appearance, and this is going to be treated by carbapenem, imipenem, and it's quite deadly. So bioterrorism. Whereas pseudomalai was in humans, malai, only malai bola, to ma'am ye animali wala disease hai. Finally, guys, your Vibrio is done, Pseudomonas is done, Burkholderia is done. So basically non-fermenters family ho gaya. Now we move on to the next set of organisms, and the quickly discussion of HBB is going to happen. What is HBB? Haemophilus, Bordetella, Brucella. Let's take three slides and finish it off. When I talk about Haemophilus, the first Haemophilus that I am going to talk about is Haemophilus influenza, which is also known as the fever bacillus. It is also known as Pfeiffer's bacillus. Kitna zara F aa raha hai, ma'am? That is going to be Haemophilus influenza Pfeiffer bacillus. Yes, this is going to require some FF factors, which I'll tell you. But please note, this is having a capsule. If it has a capsule, this means it has 6 types. Typing hamesha hota hai. And please note, the most important one is HIB, because HIB is the one, B type is from which you make a vaccine. So vaccine ke liye, and virulent wala is going to be the HIB based on a capsule. What all does it cause? We all know hemophilus influenza बच्चों में meningitis कराता है, and meningitis तो ठीक है, but influenza है तो obviously your respiratory tract involvement has to be there. Laryngotracheobronchitis, pneumonia, and other suppurative lesions of the body are seen. I'll finish off the treatment quickly, which you know is done by ceftriaxone usually for hemophilus influenza. But what did I say in the beginning? It is a hemophilus influenza fevers bacillus. What all factors? What all factors does it need? It needs factor 5 and factor 10. Actually, honestly telling you, these are V and X. These are V and X, but most people call it 5 and 10. We will also call it 5 and 10. So you know who is going to provide this factor 5 and 10. So remember, hemophilus influenza fever bacillus needs factors. So this requires factor 5 and factor 10, which is going to be given by the blood agar. So ma'am, they are not actually hiding in the blood. You will have to break the blood. Then they will come out. So how will I break the blood? I take a blood agar over here and I put a Staph aureus. Center mein kya karungi? I'm trying to act smart. I put a Staph aureus. If I go back to the first slide of my rapid revision, I have studied that Staph aureus breaks blood. So itna area mein, will Staph aureus break the blood? Does it cause hemolysis? Yes. If it will cause hemolysis, then I will say, oh, blood has broken, factors released. Matlab, party time for hemophilus. Hemophilus will say, wow, yahan pe factors hain, let me go and grow over here. Can you say hemophilus influenza has come and has started growing over here? Hemophilus influenza has come and started growing over here. So satellite ho gaya na. If this, for example, is going to be a Staph aureus, hemophilus is saying like a satellite, I'm going to grow around it because Staph aureus to party kara raha hai, treat de raha hai. Staph aureus is releasing all the factors. So yahan pe party hai, let me go and roam around it. So hemophilus is satelliting around it. So that is referred to as satellitism. Very important question. There's another hemophilus which is important, which is called hemophilus ducrei. So sabse pehle from ducrei you will learn croid. Ducrei causes ducroid, that is chancroid and chancroid. Itna cry sound aaya ma'am. When you said ducrei, I was crying. When you said chancroid, I was crying, and crying with pain because these are painful genital ulcers. Painful genital ulcers. So remember, it is a soft chancroid. Painful, and who are the people who cry? They are said that, you know, they are number one, they are crying because they have a lot of pain. So crying because yahan pain hai. And they are very soft-hearted people. They are nice people. They express themselves. That is why they are crying. So soft-hearted, अच्छे लोग हैं. They are just crying because they are in a lot of pain. So please note, when they say hemophilus ducrei, you will say croid and you will say, oh, soft-hearted person is crying with pain. Soft-hearted person is crying with pain. These are painful ulcers, because I hope you remember in syphilis, I am writing it syphilis. Why? Because everything is painless. Ye bilkul hard, made of steel, rock, stone, very, you know, not a soft person. You're gonna see a hard, painless chancre that you see over here. Syphilis mein sab kuch painless hai. He is not crying. He doesn't have any pain because he's made of steel. He's hard. Okay? That is how you learn. So ducrei is going to be crying with pain, and that is going to be a soft ulcer. What else? Now you say that, acha, he's crying so much, ma'am, he's in so much of pain. So what do you do? If someone's not in a good mood, thoda sa chocolate de do. You give him some chocolate, you give him some nutrition, give him some food, he will be happy. So what are you going to do with ducrei? You're going to grow it in a chocolate agar. Regular chocolate agar? No. You're going to give him extra chocolates because he's a little sad right now. So you supplement it with little growth factors like isovitalates or serum, basically multivitamins ki tarah, revital ki tarah. Kuch extra you are giving him because he's crying. Poor thing. Okay, so remember, this crying kid is given chocolates, and along with chocolates, little vitamins like isovitalates and fetal calf serum. Have I already told you that hemophilus ducrei? I'll remind you of that mnemonic 1 millionth time more. That D banaya tha yahan se, and hemophilus ducrei also shows you the safety pin appearance. Yes. And what is the treatment? Azithromycin. So ultimately you realize there are so many hemophilus organisms. Some of them require factor 10, some require factor 5, some need CO2, some are going to show hemolysis. Kaise yaad rakhenge? Jaldi and very simple. My favorite table, because I can finish it in 30 seconds. Which are the ones which will show you hemolysis? Ma'am, jinke naam mein hemolysis hai. Hemolyticus, parahemolyticus means these are the only two which show you hemolysis. Baki I'm not writing negative. ठीक है, which are the ones which need CO2? CO2 मतलब afro. Afro word means CO2. So if I pick up Afrophilus and Paraphrophilus, these are the only two which show me CO2. बाकी सब में वही negative. बड़ा simple है ये तो, right? Now coming to the next. Which are the ones that only need factor 5? Ma'am, 5 मतलब हम 5. पांच, पेंटा, पांच और पेंटा मैम, ऑल द पी वाला मतलब para वाला organisms will need only पांच. What are the para? ढूंढो para influenza only पांच, not 10. Then para hemolyticus only पांच, not 10. Paraprophyllus only पांच, not 10. पांच. Which is the one that only requires 10? Which is the one that only requires 10 or thus? So that is Ducree. Ducree requires only thus. So that is going to be thus. What is thus? Thus is going to be for Ducree. Thus is going to be only for Ducree. हो गया. तो 5 वाला is all para. 10 वाला is Ducree and whatever is left, दोनों. Who will need दोनों? So ma'am, भाई. When will the भाई come together? What is this भाई mnemonic? So भाई means both are needed for hemolyticus, Aegypticus and influenza. ढूंढते हैं चलो. For भाई, when I say भाई, you will say ma'am both factor 5 and factor 10 are needed for hemolyticus, okay, then for Aegypticus and then finally for influenza. And the table is done. I told you ना 1 minute का table है तो simple. Hemolysis वाले में hemolysis डालना, CO2 वाले में put the afro things, and then भाई में you will put hemolyticus, Aegypticus and influenza. Only 5 में you will put all the para people over here, पांच, and only 10 में 10, that is Ducree. Hemophilus is also done for you. What is the next one that I'm going to start off with? Let's see if you could identify this very famous disease. What did I say? Whooping cough or pertussis. This means now I'm going to start off with Bordetella pertussis. Very good. Bordetella pertussis. No points for guessing. Causes the pertussis or the whooping cough, also known as the 100-day cough. Am I going to tell you the toxin? Never, because pertussis toxin you know. I've given you a mnemonic called cyclic AMP and P was for pertussis, so this increases cyclic AMP. So what are the phases in which someone has this whooping cough? So starting wala to catarrhal phase hai. Ma'am, thoda fever, thoda cough, nothing worrying about. But although it sounds like very catarrhal, thoda, this is the one that is going to show you maximum infectivity. Maximum infectivity is going to be seen in the catarrhal phase. Very famous question. Then comes the real deal, the paroxysm. This is the time when the person has the whoop, that barking cough, right? He takes a big air ka gasp inside. That whoop is seen over here. And finally comes the stage of recovery. Convalescence always means recovery. So remember, initially there's a very catarrhal, simple wala, chota cough, chota fever phase, but that is very infective. Then comes the real whoop wala, whooping cough phase, and then comes the recovery. So what is the drug of choice? We can give erythromycin or azithromycin. And is there a vaccine? Yes, we use an acellular vaccine. Earlier they used to use a cellular vaccine, but that ended up causing encephalitis in patients. So now they don't use cellular vaccine. Now the problem is that you only have to use an acellular vaccine. You cannot. DPT mein jo pertussis hota hai na, that is acellular, and that has these 4 things. You don't have to learn their full form. But PT, you know, pertussis toxin, filamentous hemagglutinin, something for aggregation, something for pertussins ka pert. So aise hi rat lo is what I would say. Don't learn the full form. Anyway, pertussis toxins and pert, so you will anyway learn. Na? You just need to learn FHA and AGG. Something with agglutination, something with hemagglutination. So ye dono yaad rakh lo. These are the 4 things. This is the tetrad that a DPT vaccine ka pertussis has, acellular, never a cellular vaccine. But guys, I didn't tell you the culture media, because that is so simple, na? And when I'm talking about Bordetella, common sense, we are going to use the Bordet Gengu media. And BBB, Bordetella mein Bordet Gengu shows you the bisected pearls appearance. They look like nice pearls over here. And they show you the bisected pearls appearance. But imagine if these bisected pearls end up fusing, sab aapas mein fuse kar gaye. What is that going to show you? Now that is going to become if it becomes confluent, it is going to be shown as an aluminium paint appearance. So pehle to they are pearl, then they fuse and form aluminium paint appearance. If you look at this under the microscope, it's very difficult to visualize, but these are looking like prints. I'm trying to make a thumbprint appearance over here. So Bordetella is actually going to show you the thumbprint appearance under the microscope. So bas Bordetella story is done. Cyclic AMP is the toxin. Which kind of vaccine do you use? Acellular vaccine. Which is the most infective stage? Most infective stage is going to be the starting catarrhal phase. What is the culture media? Bordet Gengu media for Bordetella. Next, you're going to have bisected pearls appearance, and then you have an aluminium paint agar wo fuse kar jaye. ठीक है, microscopically it is a thumbprint appearance. Also, if you remember from your main videos, I had told you, does Bordetella have a capsule? Yes, I told you ना Bordetella की body है, body बनी हुई है, मतलब this is gonna be a capsulated organism. If you want to recall that, you definitely can. So Haemophilus done, Bordetella done. What are we left with? We are left with Brucella, which we know it is a zoonotic disease. Cows and animals and dogs and pigs इन सब में होता है. तो cow बोला ना, cow मतलब it is cow positive. Brucella, which is a cow positive, मतलब catalase, oxidase, urease, सब कुछ positive. Cow should remind you of cow, animal वाला cow, and Brucella is definitely to do with cow, right? So catalase, oxidase, urease positive. There is a triad of Brucella which is important. These patients come to you with night sweats, arthritis, and HSM, hepatosplenomegaly. Also in pathology, please note that sometimes the platelet count can also be decreased. Thrombocytopenia can be seen. That is Brucella. तो कैसे diagnosis? Ma'am, hang on. This is zoonotic disease. Animals में भी है, humans में भी है. तो diagnosis you will have to make in both places. In animals also, in humans also. तो animals के लिए तो I will do a milk ring test. If I see a purple color ring on the top, I am saying that, oh, okay, animal has antibodies. मतलब this is the milk ring test which is going to be done in animals. And नाम से पता लग रहा है ना, milk. Milk will of course come from animals. And ring, if I see a purple color ring in the top, this means there is going to be a positive milk ring test that I've got. Whereas what is done in humans? In humans, we do the standard agglutination test. What is standard agglutination test going to tell me? It's going to tell me IgG and IgM antibodies are going to be detected. In humans, I will be able to detect IgG and IgM antibodies. However, if you say, nahi, I don't want to detect IgM, I am not interested in IgM, IgM को मार दो. Remove the IgM. How will I remove them? IgM मारना है तो मारने के लिए mercaptoethanol. If I treat the blood sample with mercaptoethanol, IgM is destroyed. So remember how I have learned is mercaptoethanol मतलब IgM को मारना, right? IgM को मारना is mercaptoethanol से use करना. This is a question that you get in a standard agglutination test for Brucella. If you treat with 2 mercaptoethanol or 2-ME, which is the antibody that is destroyed, तो क्या मरेगा? Mercapto से क्या मरेगा? IgM मरेगा. So they will ask you then what are you going to test? You will be testing IgG. Very, very famous previous year question. Finally, what is the treatment? I think we all know. There's doxycycline and for 45 days and streptomycin IM which is given for 14 days. There are certain alternatives which have been given by WHO which I'm sure you guys have read about. I've taught you in the main videos. But yeah, that's the main treatment that you have. So the HBB group is also over. Haemophilus, Bordetella and Brucella. Having discussed the gram-positive cocci, negative cocci, positive bacilli and negative bacilli, now we come down to ones which do not stain well with gram. And those are MRCS, that is Mycoplasma, Rickettsia, Chlamydia and Spirochetes. And let's start with the opposite order. That is, first we're starting with the family of Spirochetes. And what all comes under it is Treponema, Borrelia and Leptospira. So if you look at Treponema, T is going to have very, very tight coils. You can see that it's a spiral. All of them are spiral, but it's very, very tight, looking exactly like a screw, right? And that is why the motility is said to be the corkscrew motility. Next, coming to Borrelia. Borrelia, as the word says, Borrelia has very, very loose spirals. They are not very tight. They are loose coils, and lula, that is how we've learnt it. It is going to show you the lashing motility. So remember, loose spirals and lashing motility. Finally comes to Leptospira. Leptospira is lapeta hua. That is how we've learnt it. Leptospira means it's going to have hooked ends. And is this also going to show you motility? Yes, it is. This is also going to show you a motility. No special name given to it. So please note that in all of these, I did not show you any flagella coming out. If there's no flagella coming out, how are all of these moving? How are they motile? Because remember, Spirochetes don't have a flagella coming out. They have a flagella inside. All of them have an endoflagella. Which part of the bacteria has an endoflagella? That is the periplasmic space. Let's begin with the first one. What am I starting with? The tight wala coils. Tight wala coils matlab I'm starting with Treponema, and the Treponema that we are going to study is Treponema pallidum, which causes sexually transmitted disease called venereal syphilis. The incubation period, which you will always remember, 9 to 90 days, is how syphilis is going to occur. And how many stages does it occur in? Primary syphilis, secondary and tertiary. So I've got you the 3 stages put up all in one go. So what is this? Primary, secondary as well as Tertiary syphilis. So remember, from today onwards, instead of syphilis, you will all learn it as syphilis, because if they ask you what is the status of the ulcer and the lymph node, everything is painless. The genital ulcer is painless and the lymph node is also going to be painless. What is that known as? That is known as a hard chancre. That is known as a hard chancre. I hope you remember this has to be differentiated. Right before this, I taught you something called chancroid. Chancroid was crying with pain, and soft-hearted people cry with a lot of pain. So that was a soft. This is painless, bilkul hard. This is painless, no crying happening over here, and this is a hard, stone-hearted person. So hard chancre, which is painless. Ulcer is also painless. Lymph node is also painless. So I called it painless. Syphilis. Now we come down to secondary syphilis. Everything should be reminded of 2 in this. So firstly, you can see that there are a lot of warts that I'm seeing at the mucocutaneous junction. These are referred to as condylomata lata. I've always learnt it as condylomatu latu because that will remind me of obviously the situation of these secondary syphilis. So condylomatu latu is how you're going to learn it. Next we have rash. So your 2 hands and 2 feet are going to show rash. So again something which you see in 2 hands and 2 feet. So that is the secondary syphilis. Now coming to the tertiary syphilis, which shows you the very famous gamma. You can see a gamma. I hope you remember from pathology that gamma is going to show you the presence of granuloma. And other than that, it shows you cardiac and CNS involvement. CNS may it causes general paresis of insane. I hope you know from medicine now that general paresis of insane, may say the insane word has been removed and now it is just known as general paresis. Hai na? And in cardiovascular, please note that there is aorta involvement. In fact, in pathology, you study a very famous thing known as the tree bark aorta. We study the tree bark aorta, and also this can cause aortic regurgitation. So the aorta is basically affected in syphilis. So primary is going to show you the ulcer, painless, syphilis. Secondary, condylomatu latu, and there are going to on what junction? If you want to complete it, condylomatu latu on the muco-Q2 junction. So mucocutaneous junction, and 2 hands, 2 feet showing you rash. Tertiary is going to show you all organ involvements with CVS, CNS, or neurosyphilis, cardiosyphilis, and it is also going to show you gamma formations. How do you do the lab diagnosis? We know that spirochetes are very patla. You can't see them on a light microscope. So you're going to use something called a dark field microscope, and you can see that spiral looking tight coils wala spiral looking organism out here. But if you say, I don't have a dark field microscope in my lab, I have a light microscope. Now what do? Patle ko mota karo. If you have a very thin organism, cover it with lots of clothes. I'll cover it with a lot of clothes and it's going to become a mota organism. So cover it with what? Silver impregnation. There is something known as the Levadity stain, and we have also studied the other one, and that is known as the Fontana stain. These are the 2 silver stains that you have. So please note F for F. Fontana stain is basically used for the fluid sample, and Levadity, when I write Levadity, the TI is going to remind you of the tissue sample. So if they say there is an ulcer ka biopsy or a tissue given, you will say, oh, tissue hai to Levadity wala silver I will use. If they say there is a film that has been prepared, a film or a fluid or a discharge, kuch bhi film, fluid, discharge aisa hai to I will use the Fontana. So F for F and Levadity, T for tissue. This is how you do the biopsy wala diagnosis. How about the antibody diagnosis, the serological diagnosis? There are some non-specific and some specific tests. Under non-specific, the first one is Wassermann test. You studied this in your immunology. It is a complement fixation test, but no one does it now. The other one is a Cahan test, which is a tube agglutination test. Again, not done now. The 2 that I have to know under non-specific are VDRL and RPR. These are definitely done nowadays, and you need to know the difference between these 2. Then I'll come to the other variety. So what is the difference between VDRL? You all remember the full form na? Venereal Disease Research Laboratory. So VDRL and RPR ka many students I have seen, they do not know the full form. Rapid Plasma Reagent. Right? Rapid plasma reagent. So remember, Venereal Disease Research Laboratory versus RPR, what is used, how is used, and what is better or less. Let us start. So this VDRL is, how I have learned it is very difficult reaction in the lab. Very difficult reaction to do in the lab is VDRL because every step is problematic. You will say that, ma'am, if you take blood sample from patient, you want to see his antibodies for this spirochetes. If you take the blood sample, you will have to heat it. Pehla problem. You can't use it directly. There is a preheating that is required. RPR says, ठीक है, हटा दो. I will not have to preheat, direct use करो. RPR is trying to be very rapid. RPR will try that it overcomes all the problems. VDRL is very, very difficult test. RPR says, I will make your problems easy. So VDRL says, pehle to you will have to heat the sample. Then after that, the antigen that you will add, that antigen is a cardiolipin antigen, and once you have prepared it, you will have to use it. You will have to use it within 24 hours. So you will have to prepare an antigen. कौन सा antigen? Cardiolipin. क्या होता है? What is cardiolipin antigen? Cardiolipin antigen is cardio, ma'am. Someone's heart it is going to come out of. It is going to come from the beef heart. It is going to come from the beef heart, and lipin matlab it has all lipid things. It is lipid coming out from the beef heart, or lecithin, or एक और lipid जैसे cholesterol. तो cardio and lipin मतलब all lipid thing, and cardio means beef heart. So you will have to require cardiolipin, and once you prepare it, you will have to use it in 24 hours. तो antibody के लिए भी heating करो, antigen के लिए भी you use cardiolipin, and then when you finally make them react, you will have to look at it under a microscope. So this is a slide based test. Then again, you need a microbiologist and a pathologist to see it under the microscope. हर जगह problem है, ma'am. Whereas RPR says that you do not need any preheating. You don't need this. You don't have to prepare anything that can be used within 24 hours. No fluid is needed, and you don't even need any microscope for this. ये card पे test होता है, तभी तो it is rapid. Have a look at this picture. This is a simple card-based test, so you will just have to read it with your eyes on a card. You don't need a microscope. All your problem is solved. So obviously the RPR is what is very, very rapid, but please remember, in VDRL all samples can be used. For example, you can use a blood sample, you can use a CSF sample, whereas RPR says अब जल्दी में सब कुछ नहीं मिलेगा. Rapid revision, if we do rapid revision, we're not doing 50 hours of syllabus, we're doing 15 hours of syllabus. So सब कुछ तो नहीं मिलेगा, important मिलेगा. So RPR says there is no CSF testing that can be done, which gets me to a very, very important question. What is the investigation of choice for neurosyphilis? Because in neurosyphilis I will be getting a CSF sample. So ma'am, CSF के लिए if you want to get like the top rank, you will have to listen to the main videos. Only RR is not enough. So please note, VDRL can even test the CSF sample. So for neurosyphilis, you will always do VDRL. Very important question. So the non-specific tests are done. Non-specific matlab they will come in many other diseases also. So I will have to opt for a list of specific tests which students find very difficult to learn. So let me simplify all these specific 4 tests for all of you. Then I'll tell you sensitive, specific and all of that. So remember, FTA, you don't have to know the exact full form, but yeah, thoda aaspas ka you should have an idea. Fluorescence treponemal antibody, ABS, is going to stand for absorption assay. So who are the people who absorb everything? Ma'am, sensitive people, happiness, sadness, emotions, they absorb everything. So which is the most sensitive test? The absorption wala. FTA absorption is the most sensitive. Next is treponema pallidum immobilization. Immobilization matlab very rigid. Matlab if it is here, it is only here and not going anywhere else. Means it is specific. If it is coming for treponema, it is only coming for treponema. So that is going to be the most specific. So absorption wala is sensitive and immobilization wala is specific. However, the problem is that treponema pallidum immobilization assay uses live treponemes. I don't want to use live treponemes in my lab and have a problem for everyone around me. So what am I going to do? Actually, then I take help of TPPA, treponema pallidum particulate agglutination test. So if they ask you in terms of specificity, theoretically speaking, TPI is the most specific, but uske baad actually practically TPPA is what is done. Finally, we have treponema pallidum heme agglutination assay, which is TPHA. So asking you if these are the 4 options given to you, what will you say? You will say FT absorption, ma'am, absorbing sensitive people. Treponema pallidum immobilization, most specific. Second most specific is treponema pallidum particle agglutination, and finally we have heme agglutination. Okay, and if I ask you what is the investigation of choice for neurosyphilis out of these, you know for neurosyphilis the very, very difficult test has to be done, and that is VDRL. ठीक है, now let's move forward. You are obviously wanting to know the treatment. That is going to be benzathine penicillin. तो tight coils वाला treponema is done. थोड़ा loosen out करते हैं. Loose coils वाला Borrelia. So now Borrelia is of 3 types. Borrelia burgdorferi, Borrelia recurrentis, and other ones that I'm going to tell you. 2-3 Vincenti, these are going to come. So burgdorferi causes what? This is one of the most common vector-borne infections in US. The history will always start as a resident of United States of America, and that disease is known as the Lyme's disease because it is the bite of the what? It is the bite of the heart tick, that is the ixodid ticks. Ixodid ticks or heart ticks are going to basically go and bite, and जहाँ वो bite करेंगे, can you see this kind of a rash? There is a redness, then there's another ऐसा concentric bullseye kind of lesion बन रहा है मैम. There is something called a bullseye lesion that is forming. So you can call it a bullseye, you can call it a target, you can call it a ring or an annular, whatever you want to call it, but actually it is erythema chronicum migrans. Erythema tells me bilkul it is a red color. Migrans tells me that it is gonna move. As you can see, it's going outside, and as it is going outside, the color in the center will become lighter. So it will keep spreading outside. Erythema chronicum migrans. This is the same picture you will get, and they will want to ask you always and always about Lyme's disease. That is Borrelia burgdorferi. Now coming to the other one, that is Borrelia relapsing fever wala ma'am. There are 2 types of relapsing fevers. The one that is caused by louse and the one that is caused by tick. So which is caused by recurrentis and which is caused by Dattoni. So Dattoni में T आता है, so that is going to be the tick-borne relapsing fever, and recurrentis is going to be louse-borne. How have I learnt it? So देखो, louse sounds like love, and this is a very famous first aid का USMLE mnemonic. Love is going to spread like an epidemic between whom? It is going to spread between human to human, and love should be obviously something that should happen again and again. You should again and again fall in love with the same person. Okay, so having said that, love for louse, it is going to spread like an epidemic, so it is the epidemic relapsing fever again and again with the same person, that is Borrelia recurrentis, and human to human is how it is going to occur. Whereas tick-borne में Dattoni आएगा, and that is going to be endemic. What is the treatment for this? Because again relapsing fever का they will say relapsing मतलब fever आएगा जाएगा. Relapses of multiple 4 to 10 relapses of fever can come. Patient will have fever, then few days he's fine, then he'll again have fever, and few days he'll fine. So the treatment is going to be tetracycline or chloramphenicol. One more thing, please collect the blood sample during the fever, during the pyrexia, because when the fever will be present, the organism will be present. When the fever will be absent, the organism will be absent. That is how it works. So take a blood sample while the patient is febrile. Last one is Borrelia vincenti, which obviously causes something in the mouth known as Vincent's angina, and that is an ulcerative gingivostomatitis. So as I said, Vincent's angina happening in the mouth. Borrelia हो गया, loose spirals. अब लपेट दो. What is that lapeto thing known as? लपेट दो means the ones that is going to have hooked ends. The hooked ends ones is going to be leptospira. What does it call? लपेट दो, wheel बना दो. ठीक है. So this was for example kind of a spiral. अब क्या करोगे? उसे ऐसा लपेट दिया, wheel बना दिया. What is Weil's disease? Weil's disease, ma'am, is icterohemorrhagic fever. Let's tell you the symptoms. Ictero, patient is going to have jaundice. Hemorrhagic, patient is going to have hemorrhage, also known as hepatorenal syndrome. There is involvement of liver and there is involvement of kidney. Wow, ऐसा होना चाहिए. The name should tell me everything. Ictero plus hemorrhagic plus hepato plus renal, that is going to be the Weil's disease. And this has the very famous, so from today onwards, you will call it leptospira. That is how you have to learn it, because this is gonna have the rat urine, and the rat urine will then contaminate what? It will contaminate the rainy water. It will contaminate the rainy water, and who will walk on that rainy water? The rainy water will go to the rice water fields, the rice fields. So the rice field workers will basically get infected with it. So remember, whenever they say rat urine has contaminated rainy water and that has been affecting the rice water field workers, you know it is a case of leptospira. तो ये आखिरी R क्या है? Because this tends to show you the Dinger's ring, and Dinger's ring is what you can see over here. Can you see there's a ring? दो है. There are 2 test tubes. In one I don't see a surface है, दोनों का surface. In one I don't see a ring, and in the other I see a ring. What medium is this? EMJH media. This tends to grow on the EMJH media, and that is going to be the Dinger's ring. So that is how you do leptospira. But best diagnosis तो है मैम antibody निकाल लो. How do I find out the antibody? By the microscopic agglutination test. So what all agglutinations have I studied? Where did did we have standard agglutination test? Standard agglutination test I studied a while ago. You studied it in Brucella. Microscopic agglutination test you are studying for Leptospira. I'm not giving you a mnemonic right now. I'll give you a mnemonic in 5 minutes because there's something called cold agglutination test in Mycoplasma. Bas wo padh ke, then I'll give you a beautiful mnemonic which came in the NEET 2023 also. So now please come back to the next thing, and that is done with this spirochetes family. So we were doing MRCS mnemonic, the ones which don't take any gram stain. So spirochetes is done. Now let's move on to the next R and C, that is going to be chlamydia and rickettsia. So what is chlamydia, guys? Chlamydia is an ABC wala organism. ABC matlab, firstly, it is A, matlab it is an atypical. बिल्कुल atypical तो है मैम, it is not taking up the gram stain, not gram positive, negative, कुछ भी नहीं है. One more thing that makes it atypical is that it is not going to grow on any of the culture media. It cannot be cultured. It is an intracellular growing organism. So remember, A for atypical bacteria, C for it cannot be cultured. And do you know what else makes it atypical? Because it doesn't have the peptidoglycan cell wall. It doesn't have a peptidoglycan wala cell wall. That is what another thing that makes it atypical. Also, it is quite a lalchi bacteria, greedy bacteria. It's going to take ATP from the host. So these are actually said to be ATP parasites. Don't make them parasites. Parasites only because it's trying to take out ATP from me. So A or C to ho gaya. These are atypical. Why atypical? Because they don't have a peptidoglycan cell wall and they cannot be cultured. Another thing, they are ATP hosts, or they are ATP parasites that you have. And finally, B for basophilic. They are going to show you basophilic inclusions, and that's the B that you have. So chlamydia is ABC. Okay, now we ask you, what are the two forms in which chlamydia is going to be present? So you will say, ma'am, ek to hai jo hame infection karayega, the one that is going to enter into us, and the one that is going to replicate into us. So please remember, this is something called an elementary body, and the other one is going to be known as a replicative body, and or in other words, it's some books also call it a reticulate body. Okay, elementary body and reticulate body. And now I can easily understand R for R. Reticulate body is the one that is going to replicate in our body. This is the replication wala. And remember, R for R, it has RNA more than DNA. On the other hand, if I say elementary body, you will say, ma'am, elementary body EE lag raha hai, the one that will enter us and exit us. The one that is going to enter us and exit us, that is going to be the elementary body. And E for equal, the DNA and the RNA is going to be exactly equal. How easy to learn this mnemonic also. So repeating, there is an elementary body which will enter and exit. Matlab they ask you infection kaun karayega aur jayega. Enter, exit is elementary, and equal, DNA, RNA equal. Reticulate body is the one that will replicate, make many copies in us, and that is going to have more of R, that is more of RNA. Done. Now how many types of chlamydia do we have? Chlamydia trachomatis, A, B, B, A, C. This to you all know. Chlamydia trachomatis, A, B, B, A, C causes trachoma, the most common infectious cause of blindness in our country, right? Whereas C ke aage chalo, D, E, F, G, H, I, K. These are the ones which cause very commonly non-gonococcal urethritis. Non-gonococcal urethritis, matlab discharge hoga. Discharge matlab that discharge can also be, the discharge can come in contact from the urethra, it can come in contact with the fingers and you can put it into your eyes. That is known as inclusion conjunctivitis. That is known as inclusion conjunctivitis. Now through that canal, if the baby passes, the baby is also going to have a problem. So these can also land up with ophthalmia neonatorum. These can also have ophthalmia neonatorum. So please note that none of these cause blindness. Neither inclusion conjunctivitis, right? Neither inclusion conjunctivitis is going to cause blindness, nor this ophthalmia neonatorum. Maybe ophthalmia, yes, but inclusion conjunctivitis does not. So remember that trachoma, ABBAC causes trachoma only, but D se aage jo hai, they first cause an NGU, non-gonococcal urethritis. From there, inclusion conjunctivitis, and in children, neonates, ophthalmia neonatorum can happen. Now we come to the serotypes L1, L2, L3. Common sense, L1, L2, L3 will cause L for lymphogranuloma venereum. These were all the trachomas that you had to know. And now I have to tell you what is lymphogranuloma venereum. You remember there was a mnemonic called ABCDEF. So jaldi se kar lete hain. What is that? Usually these patients are asymptomatic, but when they have an infection, they are going to show you these very painful lymph nodes. That is buboes. So please remember, lymphogranuloma venereum is what? You will say, ma'am, वैसे तो ulcer होगा अगर genital पे तो painless है, but because lymphogranuloma venereum has L in it, so the lymph node turns out to be painful. Then that painful lymph node is referred to as the buboes. Now we come to what is it going to show you, which organism, Chlamydia trachomatis, kaunsa wala, L1, L2, L3. Also, it can show you something called cup. What is this syndrome? Conjunctivitis, urethritis and polyarthritis. This is known as the Retter's syndrome. Finally, talking about the complications, strictures can occur. That is known as esthesiomenes. So, genitals में strictures can occur. If you have to do a skin test, what is the skin test? It is known as a Fry's test. Remember, Fry's test is a skin test for LGV. And is there any complication? Yes, Fitzhugh-Curtis syndrome. What is Fitzhugh-Curtis syndrome? It is a perihepatitis. It is a liver involvement. Where else did I teach you Fitzhugh-Curtis syndrome? If you remember, over there also I told you I will teach you with Chlamydia trachomatis. The other place was Neisseria gonorrhoeae. That also shows you the Fitzhugh-Curtis syndrome. Finally, with G, it shows you a groove sign, which is so beautifully seen over here. You will appreciate that there are lymph nodes on one side over here and a lymph node on one side over here, and there is a gaddha in the center. Groove stands for gaddha. So that groove is basically made by the inguinal ligament. So the lymph nodes are separated by the inguinal ligament. So there's a gaddha of inguinal ligament and lymph nodes are on one side, and on the other side, that is a groove. So treatment bhi bata do. Treatment is going to be drug of choice, doxycycline. So remember, buboes are seen which are painful. Chlamydia trachomatis, cup syndrome or Retter's can occur. Drug is doxycycline. Complications में esthesiomenes, and another complication is Fitzhugh-Curtis syndrome. Skin test is Fry's test. Most important, groove sign will be seen. That is lymphogranuloma venereum. So yes, coming back, your chlamydia point is totally done in terms of trachomatis. But we also have something causing pneumonia, chlamydia pneumonia. Always remember pneumonia as pneumono, because how many strains does it have? It has a single strain, and that single strain was from Taiwan. So that is known as the Tuor strain. It caused pneumonia in Taiwan. So that is Tuor. Pneumono ke paas single strain hai, whereas Sitaki has several strains. It has several serotypes which are available, and that is what is Chlamydia Sitaki. So that is going to take care of all of your things. But I want to ask you a question from ophthalmology. Are there any bodies that you see in trachoma in ophthalmology that they ask you? Have you heard of Halber-Steeder-Prowaski bodies? Yes. Halber-Steeder-Prowaski bodies are going to, so most of the places you don't see the full form only. They write it as HP bodies, right? Halber-Steeder-Prowaski bodies are seen in trachoma, which is very, very important information that you have. Whereas there is another question that you end up seeing, that is, where do you see the Leventhal Cole lily bodies? Where do we see the Leventhal Cole lily bodies? LCL it will be written as, and that is seen in Chlamydia Sitaki. These two bodies are important. So repeating, Halber-Steeder-Prowaski bodies. So Halber-Steeder-Prowaski bodies are seen in trachoma, and LCL bodies are seen in Sitaki. So all of your chlamydia is done. We can move on to the next deadly family, and that is Rickettsia. Before I start with it, I hope all of you remember that Rickettsia is something which is going to be arthropod borne. So there is something that is going to be involved over there with a tick, mite, louse. Some arthropod is going to be there, and whenever an arthropod will bite, this means the rash will be there. So all of them are going to show you the presence of a rash. There are exceptions which I'll tell you in the end. So first, these are all the different Rickettsia typhus group that you have to know. You need to know their organism, and you need to know whichever arthropod is involved. So firstly, now you need to get familiar with one column. Okay? So when I say epidemic has P in it. So the organism is going to be Rickettsia prowaski, because that also has a P in it. Then when I say endemic में तो अपना वाला नाम रखो ना, endemic is अपना वाला, so that is Rickettsia typhi अपना वाला. So typhus is gonna have typhi and prowaski is gonna be epidemic. ठीक है? Now we have Rocky Mountain Spotted Fever, R for R. Rocky Mountain Spotted Fever is gonna be Rickettsia rickettsii, again R for R. African tick typhus, no points for guessing. Rickettsia africae. So Rickettsia africae is the one that is going to show you the African tick typhus. Indian tick typhus, how I have heard it is, India में कोरोना बहुत हुआ था, तो कोरोना का common थोड़ा change करो, coronary. Indian tick typhus is going to show you, is going to be caused by Rickettsia coronary. Now we come to rickettsial pox, which is said to be the mildest of them all. Remember, rickettsial pox is the mildest infection of them all, and that is caused by Rickettsia acari. And finally, the scrub typhus, S for S, that is caused by Orientia susugamushi. So remember, scrub typhus by susugamushi. ठीक है, चलो हो गया. Epidemic for Provaski, endemic अपना वाला नाम टाइफी, Rocky Mountain spotted fever for Rickettsia rickettsii, इंडिया में कोरोना तो कॉनरी, अफ्रीका ऑफ कोर्स अफ्रीके, rickettsial pox by Akari, and scrub typhus by Susukamushi. Are all of them going to have an arthropod? Yes, I'll be telling you. Will all of them have a rash? Yes. So please note, in all of them, the rash is going to first begin on the trunk and then it is going to go on the extremities, right? So it's going to go from the trunk and then it will go on to the extremities. However, in Rocky Mountain spotted fever, ulta hai. It first starts on the extremities and from there it is going to go on to the trunk. Basically, the concept is, how I have learned it is, Rocky Mountain, mountaineering kara hai, mountain climbing kara hai. What do you do? Which part of your body comes in contact with the mountains? Your hands and your feet. So extremities पे exposure है, तो extremities में rash occurs first and then it goes on to the rest of your body. In all the others, it's the opposite. Now let's talk about the vectors or the arthropods, and for that I have a mnemonic called Let-Fentria PSM. What is let? So firstly, L will tell me that I'm dealing with the louse. So now tell me L for louse and the other one over here is going to be F for flea. One of them is epidemic typhus, one of them is endemic typhus. So fen में N आ रहा है. This must be the endemic typhus. This automatically means that the louse is going to be epidemic typhus, right? Now we come to tria. Ma'am, tria mein to this T is sounding like a tick, and now I know the ria is going to be Rocky Mountain spotted fever, Indian tick typhus, and African tick typhus. So unme to tick word is only coming. Finally, I come to PSM. M stands for mite, and now I know P and S is going to be number 1 for rickettsial pox, and S is going to be scrub typhus. Dobara kare, let, fen, tria, PSM. So first write down. When I say let and when I say fen, so flea is going to be for endemic typhus and louse is going to be for epidemic typhus. Then I'm going to write the mnemonic tria. What is tria going to be? So tria will remind me of Rocky tick is going to be for these three. Rocky Mountain spotted fever, Indian tick typhus, African tick typhus. And finally I write PSM. In PSM, mite is going to be for these two, that is rickettsial pox as well as the scrub typhus. Ho gaya table, yeah. This is what you were very, very scared of, but now I'm going to twist the table. Now tell me, this epidemic typhus happened because of what? Provaski, because of which arthropod? Louse. This happened in a person and after some time it slept off. Latent ho gaya. And after some time it woke up again, got reactivated. What is that typhus known as? Where something is going to sleep off for a while and then going to wake up later. That is a reactivation typhus, recrudescent or Brill's insert disease. This is just a variation of epidemic typhus. So is this a new typhus that has occurred, ma'am? Will I have to learn another vector, another lice, flea, mite, something? No. This is just a sleeping and a waking up reactivation scenario. This is not a new vector that you have to know, and this is going to be less severe. That is Brill's insert disease. It's a variant of epidemic typhus. Sleeping, waking up story is what you will remember. Now, if you have to, you'll say, ma'am, maximum confusion na yahan hua. This epidemic versus endemic. Koi test bata do, which I can use for the differentiation of these. Neal-Mooser's reaction or tunica reaction. Simple. Tunica. Tunica kahan hota hai? Tunica is in the testes. Is this some scrotal inflammation wala test? Yes. You are going to use a guinea pig, and if you inject this organism in the guinea pig is going to show you a tunica reaction, scrotal inflammation. So where do you get a tunica reaction? Tunica, ma'am, ab किसमें होगा? Provaski के साथ होगा या टाइफी के साथ होगा? खत्म. Typhi is going to show you a tunica reaction positive. So Typhi को अगर Tufi याद कर लो, if you learn Typhi as Tufi, you can easily learn that tunica reaction is going to be positive in Typhi. Typhi मतलब endemic. Endemic typhus में positive होगा is what you need to know. It is not going to be positive in an epidemic. So remember, tunica Typhi में होता है. Tunica reaction in Typhi, this is known as the Neal-Mooser reaction. Out of these, you know, I've already told you the clinical features of rash and everything, but one of them comes as a different clinical history, and that is going to be a scrub typhus. So how have I learned? Pehle to jaldi se learn. Whenever they will write scrub for you, you will take all the rhyming words. You will say shrubs and you will say shiggers. Scrub, shrub, shiggers. Then you will say mite, mice. It sounds like such a tongue twister. Scrub, shrub, shiggers, mite, mice. Okay, so we got that. So what do I mean by scrub? I have understood this is going to be the scrub typhus. So this is happening as a zoonotic tetrad. You need 4 things. Only then this disease will occur. Tetrad, zoonotic. Zoonotic matlab kuch animals hai. Tetrad matlab 4 cheezein. So what is it? Firstly, I need shrubs. Shrubs means that there is need of vegetations for this cycle to work. Next, we have sugars. What are sugars? Sugars are the larva of mite. माइट का जो बच्चा होता है, माइट का जो लार्वा होता है, दैट इज नोन एज शिगर्स. दैट इज व्हाई दिस इज, आई टोल्ड यू ना, PSM, स्क्रब टाइफस इज बाय माइट. तो माइट का बच्चा, दैट इज लार्वा इज नीडेड. ओके, व्हाट एल्स इज नीडेड मैम? माइस आर आल्सो नीडेड इन दिस टेट्राड. सो बेसिकली रैट्स एंड स्क्विरल्स आर नीडेड टू कैरी द इन्फेक्शन. And fourth, तो can you put yourself, because it's a zoonotic disease, it will come to you. तो हो गया zoonotic tetrad. Can I call it a sugar-borne disease? Yes. So what is it? Scrub, shrub, sugar, mite, mice. Every time I have to take a stop while saying this tongue twister. Scrub for scrub typhus, shrub for I need vegetation, sugars are mite ka bachcha, that is mite ka larva, and mice is also needed. Finally, I come down to humans, so my zoonotic tetrad is complete. How the history comes is that this, whatever this sugars or this larva, whatever happens, this is gonna result in what? It is gonna result in an eschar. In which part of your body? In some moist area of your body. It could be an axilla, it could be the groin, some area where you will miss out, some fold of your body which is moist, which you will miss out. And that is the history, that there was an eschar which was there in the axilla or the groin, which was not seen 5 days earlier or was missed by the clinician, was seen later, and they will give some forest visit of say Uttarakhand or somewhere, and they will give you something to do with this mnemonic of scrub, shrub, sugar, mite, mice. You know you're talking about a scrub typhus. Sorted with that. Now, are these any of these, ye pura family, are they going to be gram staining? No ma'am, we are doing non-gram staining organisms. So किससे stain करोगे? कुछ ऐसा डॉन वाला नाम I'm gonna say. Gimsa, Giminis, Castanida, Machiavello. ऐसा macho नाम. 4 of these I've got for you. Gimsa, Giminis, Castanida, Machiavello. So Machiavello basically macho name. So इतना बड़ा family था तो macho name of course. And the problem is that rickettsia also, I'm not telling you any culture media like blood agar, chocolate agar. For chlamydia also I did not tell you any culture media, because rickettsia and chlamydia are not grown on any of these. Rickettsia and chlamydia are obligate intracellular organisms. They will not be grown on any of these culture media. They will require cells. So either you will need some cell line for their growth, or you will need some hen's egg for its growth. They will never ever be grown on any culture solid, blood agar, chocolate agar. Ho gaya. Before I end, I want to do a cross reaction. For the diagnosis of all of these, there is something called a Weil-Felix test. What is a Weil-Felix test? It is a heterophile agglutination test. Heterophile agglutination test matlab, I want to find out the antibodies of rickettsia. From whom? From a human being. I want to find out, does a human being have antibodies of rickettsia? That is my question mark. But antigen kya use kar rahe hain? Antigen I'm using OX2, OX19 and OXK. These are antigens of Proteus. These are antigens of Proteus. So, ma'am, you are doing a cross connection. For finding rickettsia antibodies in human beings, you are using the antigens of Proteus. Yes, because they cross react, and that is the concept of Weil-Felix test. So now you don't have to learn anything. Bas ye yaad rakh lo. All of them will show OX2, OX19, whether it is epidemic typhus, endemic typhus, any kind of Rocky Mountain spotted fever. Sab mein OX2, OX19 ke saath positivity. The only one that is showing OXK positivity, and now your mnemonic is completed. The scrub typhus is going to be the only one that will show you positivity with OXK. Rest all of them are OX2 and OX19. And that sota jagta wala, remember? The one that slept off and then woke up, the recrudescent, Brill's insert, that is going to show you none of these. That is the sleeping and waking, to wo apna hi busy hai. Not going to show you any of these. I end up telling you such useless stories at times, but there is possibly no other way to learn bacteriology. So yes, that is not, that apna sota khata pita, that is apna separate. That is not going to get involved in this test. All the others are going to show you OX2 and OX19, and scrub typhus is going to show you K for OXK. Finally, the treatment is going to be doxycycline or tetracycline, and one part of your rickettsia is over. But do you know, now I'm going to tell you an exception. There is something called Coxiella. You know, Coxiella is also a member of the rickettsia family, but this is not going to have any vector, any Weil-Felix test, any rash. Totally alag. Totally alag. Matlab, ma'am, no vector, so good news for us. I don't have to learn any tick, mite, louse, nothing. No vector. And when no vector will bite, if a tick will not bite me, so rash bhi nahi hoga. No vector, no rash. So how does it happen? So remember, the name of the organism is Coxiella burnetii. It can happen by inhalation. It can also happen by other routes like ingestion, inoculation, but inhalation is very, very important. So always note that this also is another eye called an intracellular parasite. Rickettsia ki tarah, all of them are growing in cells. And have I already told you what does it cause? Coxiella causes Q fever. Q because earlier it was like query fever. They did not know which organism causes it. Now they know it, but still it's known as Q fever. And this donut is also looking like a Q, because I have always told you in pathology that Q fever shows you what under the microscope? It shows you the donut granuloma. What is the other name for donut granuloma? It is a fibrin ring granuloma. It shows you the presence of fibrin ring granuloma. That is what you see with Coxiella. So donut mein se line banana, that is donut granuloma. Done. Okay, so now we come down to how are you going to do the treatment. Again, like all rickettsia, you will be using tetracycline. So that is the same treatment that you're having over here. Now, although we are still in Rickettsia family, I'm going to have another set of members known as the Bartonella. That's going to end this family. The Bartonella family is also arthropod bone, so I will be telling you that, but there are three Bartonellas called Bartonella bacilliformis, quintana, as well as Hensley. So please note, Bartonella bacilliformis, from today onwards, this is how you will write bacilliformis, because what does it cause? OR for Oroya fever. It causes Oroya fever, and that is also known as carry-on disease. So OR se to yaad ho gaya, carry-on disease or Oroya fever. And what is SF gonna remind you? SF will tell you sand fly. What is the vector? The vector arthropod that you have over here is sand fly. Easy. Bacilliformis, Oroya carry-on disease, and sandfly. What is Bartonella quintana? Quint means 5. Quint means 5. So it causes the 5-day fever or the trench fever. It causes the 5-day fever or the trench fever. Ma'am, what is the vector? 5 alpha. So I'll give you options. Louse hai, ya mite hai, ya tick hai. So you'll say mite mein 4 alphabets. M-I-T-E. Nahi. Tick में TICK 4 alphabets नहीं, कुछ 5 alphabets वाला बताओ मैम, because it is causing 5-day fever. So the 5 alphabets वाला is louse. So the arthropod is definitely going to be louse over here. And what does it cause? It causes the 5-day trench fever. Coming to Bartonella Hensley, where everything is going to be related to hemorrhage. Firstly, if a cat scratches you, of course there's going to be hemorrhage. So this causes what? It causes cat scratch disease. Next, what else? It is going to cause everything to do with hemorrhage, ma'am. So it is going to cause bacillary angiomatosis, lots of blood vessels. Bacillary angiomatosis in the liver and the spleen, it causes peliosis. Peliosis is also nothing but sinusoidal dilation. The sinusoids are getting dilated. So, matlab blood vessel is only getting dilated. So, ultimately, if a cat will scratch, there will be bleeding. If there is angiomatosis, so bleeding yaad aa gaya. Peliosis is also blood vessels getting dilated. So, all hemorrhage things are Bartonella Hensley. And what have I taught you in terms of a granuloma? What granuloma is seen with cat scratch disease in pathology? Please integrate. Cat scratch disease shows you the famous stellate, star-shaped wala granuloma, isn't it? Which other disease shows you the stellate granuloma? It is lymphogranuloma venereum. And that wraps up all of your information over here. I hope everyone's okay with this. Rickettsia, chlamydia, done. We were doing an MRCS mnemonic. MRCS mnemonic basically tells me that I have done with the gram-poor organisms. Spirochete ho gaya, chlamydia ho gaya, rickettsia ho gaya. The last one is mycoplasma. Mycoplasma ka mnemonic hai mycoplasma. Best one of these. Mycoplasma or the Eaton's agent is your mnemonic. So let me start. What is it about mycoplasma? Ma'am, this is the most common cause of two things. The most common cause of walking pneumonia. Walking pneumonia means patient is going to walk into your OPD himself. He's not bedridden or in the ICU. Walking pneumonia and typical to nahi hai. It is the most common cause of community-acquired pneumonia under the atypical category. See, if they would have asked you what is the most common cause of community-acquired pneumonia, I would have thought of bacteria, streptococcus pneumoniae. But if I ask you the most common cause of atypical community-acquired pneumonia, that is going to be mycoplasma or Eaton's agent. Now, this shows you a test called cold agglutination test. Co for cold agglutination test is seen. So, we've done so many agglutination tests. I will come to a summary in the end. But why is this always said? Some people say bacteria hai bhi. Is it a bacteria? Why are they doubting it? because number one, it's cell wall deficient. C se matlab it doesn't have a cell wall. And the cell membrane that it has sterols. Dekho, bacteria don't have sterols. But this is a weird one. Bacteria have cell walls, this doesn't. Bacteria doesn't have sterols, so this has. So isme sab alag ho raha hai. That is why they are saying, is it even a bacteria? Big query on that. Cell wall is not there and cell membrane has sterols. What is PLA? PLA will remind you of PPLO. You know the other name of this organism is PPLO, pleuropneumonia-like organism. And that is why the agar that I'm using is the pleuropneumonia-like agar, on which it shows you the fried egg colonies. The PPLO agar is going to show you fried egg. But you know kya problem hai? Fried egg to ma'am samajh aa gaya. These colonies are very tiny. Why? Because सबसे पहले this organism is only SMA, mycoplasma का SMA. This organism is only very tiny. Colonies are also very छोटा छोटा. तो ma'am, how will I make those colonies prominent? I am going to add a stain called the Dine stain. So can you see in the next picture, suddenly the colonies have become a little more visible. I have added, so remember Dine stain is not what you put on a slide as a microscope wala. Dynes is what, this is a culture plate. If this is a culture plate and on this some fried egg is there, ma'am nahi dikh raha. I'll say, okay, put a few drops of Dynes and then look at it, you will be able to see it. So that is the stain. I hope you all have not confused it with the Dynes phenomena. Dynes phenomena was seen in Proteus, isn't it? Coming back, this is mycoplasma. Quickly, most common cause of walking and atypical community acquired pneumonia. Co for cold agglutination test. Cell wall nahi hai, cell membrane has sterols. PLA for PPLO agar, fried egg colonies, very very chota colonies, very very chota organism. So I will have to use a stain called the Dine stain. Mycoplasma is pretty much done. Drug of choice bata do, that is going to be the macrolides. And I had promised you that I'm going to give you a summary of all the agglutination tests. So cold agglutination test, standard agglutination test, microscopic agglutination test. Mnemonic kya bana? There is a cat who sat on the mat. There is a cat who sat on the mat. So cold, standard and microscopic. Cat is known as Billy. So we learn it as my Billy. What is my Billy? The first one is going to be my for mycoplasma. The second one is going to be brucella. And the third one is going to be the leptospira. So let's get going. Cold agglutination test is seen in mycoplasma. Standard is seen in brucella and microscopic is seen in leptospira. Simple. Cat sat on a mat, my Billy, and these are the agglutination tests done. This is a NEET PG 2023 March 5th ko jo hua tha. That exam had the same question on microscopic agglutination test for leptospira. Okay, so mycoplasma is done. The last set of organisms that we start with are the miscellaneous organisms, and those are going to be the bacters. Campylobacter and Helicobacter, right? They are said to be COPS. COPS matlab number one, they are catalase, theek hai, catalase positive. Number two, they are also oxidase positive. So P is going to be for positive. They are catalase oxidase positive, and they are also going to be spiral organisms, comma shape, S shape, ऐसा shape होगा. They are catalase oxidase positive and spiral shaped organism. That is what you have for bacters. Campylobacter also, Helicobacter also. Campylobacter के लिए तो best है that you learn this story, because this is going to give you a lot of information. I'll quickly tell you the story. Firstly, Campylobacter jejuni is the organism. Jejuni will tell you it grows in June ka mahina. What is the temperature in June ka mahina? 42 degrees centigrade. So Campylobacter jejuni is going to grow at 42 degrees centigrade. Jejuni tells me that. Bacter tells me they are catalase oxidase positive spiral rods. I know that. What is this Campylo going to tell you? So whenever you go camping, what are you worried about? Kya tension hota hai camping mein? So you will say, ma'am, camping mein what will I eat? Okay, how does this happen? This is basically because of ingestion of contaminated poultry. So if you end up eating some bad things, na, you will have that problem. So sabse pehle I am writing down the same mnemonic over here. The mode of transmission is going to be the ingestion of what? The ingestion of some kind of contaminated poultry. So because you were tensed about food. What are you tensed more about? After food, I am tensed about water. Water, where will I drink water from? Where will I go to the washroom from? Water and loo, watery loo होता है. इसके अंदर patients are gonna have watery diarrhea. ठीक है, they are gonna have watery diarrhea anyway. like our mothers say, जून के महीने में 42 degree centigrade, please don't go under the sun, have a lot of water because लू लग जाएगी. That is what your mother say, लू, watery loo. So remember, watery diarrhea is what these patients are gonna have. What else? Okay, now camping कर रहे हो. Camping का usually packages देखोगे ना, 1 week का package होता है. तो incubation period is gonna be 1 week. The incubation period is gonna be 7 days because camping का package 1 week का होता है. Further, if you see, camping में क्या है? You will be looking at the beautiful stars above you, isn't it? So yes, what is it regarding the stars that you will see? You will see nice effused droplet-like colonies. You're gonna see colonies which are gonna look like beautiful chota stars. They are gonna look like effused droplet-like colonies on which agar? Campy-BAP agar. You're gonna see it on the Campy-BAP agar. Also, there are other media like the Schiromedia, and there's something known as the Budsler media. Right? There's something known as the Budsler, Schiro or Campy-BAP. So Campy-BAP पे you will be seeing the effused droplet-like colonies, and इतना ज़्यादा worry करोगे, if you will worry so much, you will end up going mad और CNS problem हो जाएगा. These patients can be associated with Guillain-Barré syndrome. Yes, there has been association with GBS also. Finally, I told you they are spiral. I can see that. I can see that they are comma shape, S shape, as a spiral. This is also known as gull-wing shape. They can be comma, they can be S, they can be gull-wing. And now I'll tell you something more for the stars. Which kind of motility do they have? They have the shooting star or the darting motility. They have the shooting star or darting motility, which was also shown by what? Which was also shown by Vibrio cholera. Remember, Vibrio भी comma shape था, वो भी shooting star था, ये भी comma shape है, ये भी shooting star है, correlation हो रहा है. Okay, quick revision on mnemonic. Campylobacter jejuni. Jejuni means जून का महीना, 42 degree पे grow करेगा. Bacter means catalase oxidase positive spiral rod. Campy means the media is Campy-BAP, on which I'll see these chota stars, effused droplet colonies. Okay, the camping duration is usually 1 week. What all I worry about? Food. This is because of ingestion of contaminated poultry. Watery loo, watery diarrhea happens. Shooting star or darting motility is seen, and itna worry karoge to brain problem ho jayega. That is going to be Guillain-Barré syndrome. That is the story of Campylobacter, because now I can go on to this organism. What is this? I've directly shown you the picture. This is Helicobacter pylori. So yes, is it also catalase oxidase positive spiral rod? Yes, but there's one more enzyme which is positive over here, which I've always told you. It is also urease positive. What are the diseases that Helicobacter pylori causes, ma'am? 4 diseases it will cause. चारों stomach का problem है. What is it? Number 1, it causes gastritis. After gastritis, ulcers will form, to peptic ulcer disease, and 2 cancers will form, adenocarcinoma of the stomach and maltoma of the stomach. So सब stomach वाला problems है. But they ask you, how does it cause cancers of the stomach? It has something called CAG-A and VAC-A. What are the 2 things that God has given it for causing cancers? CAG-A and VAC-A. The last question is that they ask you, what are the different stains? So we all know the famous Warden Starry Silver stain that you use over here, and also sometimes you can use a rapid wala stain called the modified Giemsa stain. Identify ho gaya? If not, I'll quickly revise. Warden Starry Silver stain has given it a little bit of a silver, na, to silver matlab black color. Warden Starry, let's repeat it. Warden Starry Silver stain. Ma'am, wherever the word silver will come, you will get a black color. So Warden Starry Silver stain will give it a black color. Modified Giemsa ke saath you can see this bluish color that has come. With that, the bacters also come to an end. But before I finish off your bacteriology rapid revision, I want to quickly make you revise 3 tables of all the toxins. Tell me guys, which are the toxins? Quick revision. Which are the toxins which are gonna act by decreasing the protein synthesis? Rapid revision ka bhi ultra rapid in 2 seconds. Decreasing DPS, decreasing protein synthesis, DPS. So we have diphtheria toxin, D for diphtheria toxin, PS ko jodo to it was the Pseudomonas. Pseudomonas का कौन सा टॉक्सिन? एक्सोटॉक्सिन A होता है in Pseudomonas. That is what is there. And S and S is going to be Shiga toxin. Of course, ma'am, Shiga is going to be in Shigella. And then there is a Shiga-like toxin. Then there is a Shiga-like toxin that we have, and that is also known as the verocytotoxin. Okay, all of these are going to act by DPS, decreasing protein synthesis. But how? These 2, the first 2 and the last 2, split kar do. The first 2 are going to be basically causing ADP phosphorylation of EF2. That is how they cause ADP phosphorylation of EF2. That is how they decrease the protein synthesis. Whereas the Shiga ones, they are going to inhibit 60S ribosomes. They are going to inhibit 60S ribosomes, and that is how they will decrease the protein synthesis. So see, all of them decrease protein synthesis, but how is it different? Diphtheria and Pseudomonas are going to cause ADP phosphorylation of EF2, whereas Shiga ones are going to cause reduction in the 60S ribosomes. This is one set done. The second revision is which are the ones that act by cyclic AMP and GMP. तो cyclic AMP में हमने क्या निमोनिक बताया था कि M को change कर दो, it becomes CAEP, right? Twist कर दो. So number one, cholera is going to act by cyclic AMP, anthrax is going to act by cyclic AMP. We have enterotoxigenic E. coli का labile toxin which acts by cyclic AMP, and pertussis, Bordetella pertussis acts by cyclic AMP. Then what acts by cyclic GMP? Ma'am, इसका labile toxin वहाँ था, तो enterotoxigenic E. coli का stable toxin is going to come up over here. How do I learn it? There's a very famous mnemonic that labile in the air and stable on the ground. Labile in the air and stable on the ground. So labile wala was cyclic AMP and stable wala is going to be cyclic ground, GMP. Further, we also have two things which I'm going to add. There is something called Bacillus cereus. Bacillus cereus causes ek to vomiting wala food poisoning. That is going to be by cyclic GMP. That is going to be by cyclic GMP versus Bacillus cereus also causes a diarrhea wala food poisoning. दो type का food poisoning, and diarrhea wala is going to be by cyclic AMP. Do you guys remember this mnemonic? How did we learn it? That anal canal के through diarrhea होगा, तो cyclic AMP will be involved in diarrhea. And गले से vomiting होगा, तो emesis वाला is going to be cyclic GMP. So repeating, गले से vomiting होगा, तो emesis वाला is GMP, and anal canal से diarrhea होगा, so diarrhea wala is cyclic AMP. This is done. Two more toxins which you read earlier. Have you read where is toxic shock syndrome? Where have you read Staphylococcus, ma'am? Staphylococcus aureus causes toxic shock syndrome. What is the other name for the toxic shock syndrome toxin? Enterotoxin kaun sa wala? F. F will remind you of fatal disease in female. Why in female? Because toxic shock syndrome is associated with tampons. So remember, toxic shock syndrome is caused by enterotoxin F, fatal female disease. Finally, what are the toxins of tetanus? Tetanus has tetanolysin, tetanospasmin. They ask you which of them causes tetanus. It is tetanospasmin that causes tetanus. This is the one toxin that is important, right? Okay, that was a very, very rapid review of your toxins because I wanted to put it up in one place in the end, and that marks the end of your bacteriology RR. What I've also done for you guys in the notes is I've given you a final list of all the culture media, because if you've gone through this RR of 5 hours or so, after that you don't need to listen to it again and again. Just keep revising that list over and over again because your mnemonics are already with you.